She walked into the emergency room with scars running the full length of both arms, and within 30 seconds, the whispering started. By the end of her first shift, they were calling her unstable, damaged, a liability waiting to happen. Nobody asked how she got the scars, nobody asked what she'd survived. They just decided, the way people always decide about women who look like they've been through something, that whatever broke her must have broken her permanently. They were wrong about every single part of that. And the night a bleeding soldier was carried through those doors, they would all find out exactly how wrong. Before we go further, if you're watching this and you've ever been underestimated, written off, or judged before anyone bothered to learn your name, this story is for you. Hit subscribe right now so you don't miss what happens next, because this channel is where the quiet ones finally get heard. Tap the like button if you're already feeling this, and drop a comment telling me what city and country you're watching from. I want to see exactly how far this story travels. Now let's get into it. The drive into Millhaven, Colorado took 4 hours from Denver, and Sloane Merritt spent most of it with the radio off. She didn't need music. She needed the silence to recalibrate, the way she always did before walking into something new, something unfamiliar, something that required her to perform a version of herself that fit the space without drawing attention. It was a skill she'd practiced for years, longer than she'd been a nurse, longer than most people assumed she'd been doing anything requiring discipline. The mountains outside the window were gray-green and patient, and she matched her breathing to them without thinking about it. Millhaven was the kind of town that looked smaller than it was on maps. Nestled in a valley between two ridgelines, it had the architecture of somewhere that had started as a mining community and gradually reinvented itself into something with a hospital, 2 high schools, a diner that claimed to have the best green chile in the state, and enough quiet to make a person either heal or go quietly insane. Sloane was counting on the former. Hargrove Regional Medical Center sat on the north edge of town, a 3-story building that had been renovated twice in the last decade and showed it. The eastern wing was glass and steel, modern and efficient, while the original structure behind it was brick and tile and the particular beige of institutions built before anyone thought too hard about color. The emergency department was in the new wing. Sloane had looked it up before she drove out. She'd looked up everything: the trauma volume, the staff-to-patient ratio, the case mix index, old habit, the kind of preparation that had kept her alive in environments where improvisation was only for people who'd already done the homework. She pulled into the employee parking lot at 6:47 in the morning, 13 minutes before her orientation was scheduled to begin. She sat in the car for a moment longer than necessary, pulling her sleeves down over her forearms, checking that the fabric sat flat over the ridged lines of scar tissue that ran from her wrist to just below her elbows on both sides. Not because she was ashamed, because she wasn't ready for the questions yet, and in her experience, the questions always came before anyone had bothered to form an actual impression of her work. She grabbed her bag and went inside. The charge nurse who met her at the ER entrance was a woman named Deborah Solis, early 50s, efficient in the particular way of someone who had stopped performing friendliness at work sometime around year 12 of the job and simply functioned instead. Deborah handed Sloane a badge, walked her through the unit layout in under 8 minutes, and told her the break room had a broken microwave that facilities had been promising to fix since March. "You'll be floating between Trauma Bay and Fast Track for the first 2 weeks, Deborah said, not unkindly. "We like to see how people move before we lock them into a pod assignment. Any questions?" "Where did the trauma alert stage?" Sloane asked. Deborah looked at her for half a beat. "Bay 2 and Bay 3. Bay 1 is reserved for codes. And the supply room, is it keyed or badge access?" "Badge." Deborah studied her briefly. "You've done ER before." "I've done a lot of things," Sloane said. It wasn't evasion, it was just the most accurate thing she could have said. Deborah seemed to accept it, and she moved on to introduce Sloane to the day shift nurses coming on. A cluster of 4 women and 1 man gathered around the nursing station, all of them going through the particular choreography of handoff, charts passed, notes compared, the rhythmic shorthand of people who worked closely enough together to finish each other's sentences. The man's name was Pete Navarro, quiet and methodical, the kind of nurse who double-checked everything twice and apologized for nothing. He gave Sloane a nod and went back to his chart. The other nurses did the standard thing. A round of names Sloane filed carefully, assessing each face for the information people don't say out loud, but always broadcast if you know how to look. Most of them were neutral, curious maybe. New person energy was what it was. One of them was not neutral. She was standing slightly apart from the others, leaning against the counter in a way that managed to look both casual and hierarchical, like she owned the space and was allowing others to inhabit it temporarily. Her name tag said Rachel Voss, RN, and beneath the name, a second line, Senior Staff ED. She was maybe 40, with a put-together look that in other contexts would have read as professional, and in this one, read as the particular vanity of someone who used their appearance as a status indicator. Rachel looked at Sloane. Her eyes went to the badge, then to Sloane's face, then, very deliberately, to Sloane's arms, where the edge of a scar was just barely visible at the wrist line below her sleeve. It was a brief look, clinical in its detachment. Then Rachel looked away, and her expression settled into something that Sloane recognized immediately, the quiet, satisfied decision that had already been made. She'd seen it before. She knew how to wait it out. The first 3 hours were unremarkable in the way that first days are often unremarkable. Sloane moved through the department learning its rhythms, its particular bottlenecks and shortcuts, where the equipment was actually kept versus where it was supposed to be kept. She asked targeted questions and kept her movements efficient and stayed out of the way of the people who needed to be in the way. At 9:15, a 72-year-old man came in with chest pressure radiating to his jaw. Sloane was the first nurse to reach him. She'd already pulled the EKG cart before the attending made it to the bedside, had leads placed and a 12-lead running in under 3 minutes, had his blood pressure and oxygen sat, and a large-bore IV established by the time Dr. Marcus Ewan walked through the curtain. Ewan looked at the EKG, looked at Sloane, and said, "Good catch on the leads." "ST elevation in 2-3 and AVF," she said. "Inferior wall. He's been symptomatic for about 40 minutes. Ewan was already reaching for his pager. "Call the cath lab." She already had the phone in her hand. The patient went to the cath lab 20 minutes later. He would survive. Sloane didn't think much about it. It was simply a patient who needed something, and she knew what it was, and that was how it was supposed to work. But the exchange with Ewan was noticed. She felt it. The particular atmospheric shift of a room recalibrating, the way 3 nurses at the station looked briefly at each other after she walked past. Not hostile, just recalibrating. Rachel Voss's expression, when Sloane caught it briefly from across the department, had not recalibrated. It had sharpened. The break room at 11 o'clock held 4 nurses, a half-eaten box of crackers, and the specific energy of a conversation that had just changed subjects as someone walked in. Sloane poured coffee and didn't sit down, standing at the counter with her back to the room and listening without appearing to listen. Another old skill, the kind that got practiced in environments where the conversation in the next room sometimes contained information you needed to not be surprised by later. "Transferred from somewhere in New Mexico, I heard," one of the nurses said. A younger woman named Tiff, who had a habit of pulling the end of her ponytail when she was nervous, which appeared to be most of the time. "ER there, apparently." "She seems competent enough," Pete said. This was the closest Pete apparently came to enthusiasm. "Did you see her arms?" This was a voice Sloane didn't need to turn around to identify. Rachel Voss had a particular pitch when she was performing casual concern. "I mean, I'm not trying to make it into something, but those scars, both arms, that's not from any kind of accident." Silence. "She could have," Tiff started. "I'm just saying," Rachel said smoothly, like someone who had perfected the art of the implication. "We're a trauma department. We have patients in crisis every single shift. If someone has their own unresolved history, that's something that matters. That's something I'd want to know about, for patient safety." Sloane took her coffee and walked out of the break room. She didn't hurry. She didn't look back. Patient safety. That was the phrase Rachel had chosen. Sloane had to give her credit for the architecture of it. The way it dressed judgment up as concern, made cruelty look like due diligence. She'd seen that particular construction deployed against people before, usually against people who'd survived things that left marks. She went back to the floor and did her job. The week progressed. Sloane was good at her work in the way that people who've spent years operating under pressure are good. Not flashy, not performative, but precise and fast and consistently right in the moments that required it. On Wednesday, she caught a medication error before it reached a patient. On Thursday, she managed a pediatric airway situation in the trauma bay with a calmness that made the attending, a harried woman named Dr. Priya Sandoval, look at her sideways for a moment before saying simply, "Nice work." On Friday, Rachel Voss made her first direct move. It was subtle. Most of the effective ones were. Sloane had been assigned a patient in Bay 7, an elderly woman named Mrs. Kwan with a hip fracture who was in significant pain and needed careful positioning and a detailed medication reconciliation before anything else happened. Sloane was mid-reconciliation, working through the woman's list of 12 daily medications and cross-referencing for interactions, when she became aware that Rachel was standing at the nurse's station across from the bay, not doing anything in particular, just standing there with a tablet and talking to someone. The someone was Janet Holt, the department's administrative supervisor. Sloane knew her by the lanyard, a red one, different from the standard blue. She couldn't hear what Rachel was saying. She could see the angle of Rachel's body, the way she was positioned so that her eyes were on Sloane's bay, while her face was turned just enough to suggest she wasn't looking. Mrs. Kwan said something, and Sloane brought her full attention back to the patient. "I know, sweetheart," Sloane said, adjusting the pillow under the woman's hip. "We're going to get you something for the pain as soon as I finish making sure it's safe to give it to you. I need you to hang on for just a couple more minutes. Can you do that?" Mrs. Kwan, who was 81 and had apparently survived considerably more difficult things than this, said, "I've been doing that my whole life." Sloane smiled at that, genuinely. "Yeah," she said, "me too." She finished the reconciliation, identified a dangerous interaction between two of the woman's blood pressure medications that the admitting team had missed, flagged it to the attending, and had appropriate pain management initiated within the time frame she'd promised. When she looked back at the nurse's station, Rachel and Janet Holt were gone. The conversation happened on Monday of the following week. Janet Holt's office was on the second floor, and the summons came through Deborah Solis, who delivered it with the particular expression of someone who didn't like delivering it but was doing it anyway. Sloane went up at 2 in the afternoon, still in her scrubs, still running on 4 hours of sleep because she'd picked up a partial overnight on Friday that had run longer than scheduled. Janet Holt was a careful woman, the kind who used words like concern and feedback and process in a way that sounded bureaucratically neutral but functioned as a very specific kind of pressure. She had a way of folding her hands on the desk in front of her that suggested she had given this particular speech before. "We've received some feedback," Janet said, "from a senior staff member about some observations about your conduct in the department." Sloane waited. "Specifically, there's been a concern raised about your composure under pressure." "My composure," Sloane said. "The concern," Janet continued, "is that someone with certain personal history might not be the best fit for a high-acuity trauma environment, that there may be triggers that could affect patient care." The word triggers landed with the particular weight of something that had been chosen carefully, clinical enough to sound professional, vague enough to mean anything, specific enough to point directly at the scars on Sloane's arms without mentioning them. "Has there been a specific incident?" Sloane asked. "A patient complaint? A documented error?" "This is more of a proactive conversation. Has any attending I've worked with this week raised a concern about my clinical performance?" Janet paused. "No." "Have there been any patient safety events involving my care?" "No." "Then what we're talking about," Sloane said, keeping her voice entirely even, "is appearance-based speculation from someone who has never observed my work in a critical situation." Janet's folded hands tightened slightly. "I understand that might feel unfair." "It's not about feeling," Sloane said. "Either there's documented evidence of a clinical concern or there isn't. If there's documentation, I'd like to see it and respond to it formally. If there isn't, I'd like to go back to work." There was a long pause. "I'll note that you responded to the feedback," Janet said finally. Sloane stood. "Thank you for your time." She walked out of the office and down the stairs and back to the floor, and she did not let any of it show on her face because she had spent a very significant portion of her life learning not to let things show on her face in moments when showing them would cost her something she needed. But in the stairwell, between the second floor and the first, she pressed her back against the wall for 15 seconds and just breathed. Then she went back to work. The second week brought a different texture. Rachel had apparently decided that the administrative approach needed reinforcement because she shifted to a more direct strategy, the kind that operated through proximity and public comment and the very specific social mechanics of a workplace where everyone could hear everything and everyone's reputation was built or demolished through accumulated small moments. On Tuesday morning, Rachel watched Sloane draw blood from a difficult stick, a dehydrated patient with collapsed veins, and said, loudly enough for the surrounding staff to hear, "Sometimes the hand that shakes doesn't belong at the bedside." Sloane's hand had not been shaking. She got the draw on the first attempt, but 3 people had heard the comment, and she watched it land on them. The slight hesitation, the new uncertainty, and understood what Rachel was building. Not an incident, not a complaint, a climate. On Wednesday, a young woman came into the ER in the middle of a panic attack, hyperventilating, dissociated, unreachable, through the standard language of medical reassurance. The attending on was Dr. Yuen, who was managing 2 other patients simultaneously and called for a nurse to manage the situation. Sloane went in. She sat on the edge of the chair beside the woman's bed, close enough to be present, far enough to not crowd her. She didn't immediately speak. She breathed, slowly, audibly, in through the nose and out through the mouth, not instructing the woman to match her, just doing it in a way that was available to match. It took 4 minutes. Slowly, incrementally, the woman's breathing began to find a different rhythm. "I've got you," Sloane said when the hyperventilation started to ease. "You're not going anywhere. I'm right here." The woman was 23 and had just had a fight with her mother on the phone and hadn't eaten since the previous morning, and her blood sugar was low, and her baseline anxiety disorder was poorly managed. And all of those things compounded into a crisis that looked frightening but was workable if someone just stayed. Sloane stayed. An hour later, the woman was medically cleared, had a referral to a psychiatry outpatient clinic, and had eaten a cup of applesauce and a pack of crackers from the supply cabinet that Sloane had quietly retrieved without making a thing of it. Rachel watched the discharge happen from across the department. "Playing therapist now," she said as Sloane passed. "Is that in your job description?" "Treating the patient," Sloane said. "That's in everyone's." She kept walking. On Thursday, she found out through Pete Navarro, who mentioned it in the particular way of someone who thought she probably should know, that Rachel had been in Janet Holt's office again. "She's pushing for a formal fitness review," Pete said, not looking directly at her, focused on his charting. "Saying you don't have the psychological stability for trauma work, that the scars on your arms are evidence of whatever she thinks they're evidence of." Sloane absorbed this. "How do you know?" she asked. "I know because Janet asked me if I'd noticed anything concerning about your clinical work." He finally looked up. "I told her no, because I haven't." "Thank you." "Don't thank me. That's just accurate." He looked back at his chart. "Whatever she's building it. I don't know how to stop it." Sloane didn't know either. She knew how to stop things that had identifiable targets, clear threat vectors, defined moments of commitment. She'd done that work for years in environments where the intelligence was reliable and the rules of engagement were understood. This was different. This was the slow dismantling that happened through whisper and inference and HR language, and the weapons you used against it were documentation and patience, and the kind of quiet endurance that felt almost passive but wasn't. She started keeping notes. Every comment she heard Rachel make, every meeting she was aware of, every patient interaction she handled, and the outcome. Nothing dramatic, just dates and times and clinical results, the factual record of a person doing their job correctly. Friday night brought a thunderstorm that rolled in from the mountains around 7 o'clock, dropped the temperature 12 degrees in 30 minutes, and generated a spike in ER volume that the department handled the way it always handled volume spikes. With controlled chaos, everyone moving faster than ideal, decisions compressed, margin for error reduced. Sloane was managing a 3-patient assignment in the trauma-adjacent pods. A post-reduction shoulder, a woman in early labor who'd been redirected from the maternity ward due to an elevator malfunction, and a teenage boy with a laceration on his forehead that was dramatically bloody but structurally uncomplicated. She was moving between all 3, keeping the laboring woman's vitals tracked, keeping the teenager calm enough to stop pulling at the gauze on his head, keeping the shoulder patient from trying to put his jacket on by himself. It was the kind of night where you couldn't think too far ahead. You triaged the present and trusted your training and moved. At 9:45, the radio on the charge nurse desk crackled. Deborah Solis's voice went flat and precise in the way it did when something significant was incoming. Incoming trauma. 7 minutes. GSW to the left chest. Single entry. Exit unknown. Patient is military, active duty, stable for now. The department shifted. Sloane handed off the laboring woman to Pete, confirmed the shoulder patient's discharge was cleared, put the teenager's laceration in the hands of the PA on shift, and moved to the trauma bay. She wasn't assigned to incoming trauma. That wasn't her pod. But she'd heard the transmission, and something in her had already recalibrated. Not consciously, not deliberately, but the way a compass orients to north without being asked to. She stood at the edge of Bay 2 and waited. The ambulance doors opened at 9:52. He came in on a gurney, backboard, 2 paramedics on either side, 2 other men walking alongside who were not paramedics, big, controlled, with the specific bearing of people who moved through crisis as a professional baseline. One of them had blood on his sleeve that wasn't his. The patient was a man in his late 30s, tall, even horizontal, built in the way of someone who had spent years being systematically functional. His face was gray under the overhead light, but his eyes were open, tracking. There was a field dressing on his left chest that had been applied by someone who knew exactly what they were doing. Not a civilian improvisation, not a paramedic's standard kit. Something tighter, more intentional. Someone had packed that wound before the ambulance arrived. The attending trauma physician, Dr. Sandoval, came in from the left, gloved, already calling orders. Sloane moved to the right side of the gurney, the non-physician side, the nursing side, and started. Vitals. IV access assessment. Medication inventory. Airway check. She did it in the compressed parallel way of someone who had done trauma assessment in conditions significantly less controlled than this. And she did it without being told to because there was no moment here that could be used for being told things. The patient's eyes found her. She noticed it without stopping. GSW to the left chest, one of the paramedics was saying to Sandoval. Approximately 90 minutes ago in the field dressing applied on scene. Who applied the dressing? Sandoval asked. We did, said one of the 2 men, who wasn't a paramedic, a low controlled voice that carried. Sandoval looked at him briefly, then back at the patient. Sloane was checking the field dressing, careful, assessing for tension pneumothorax, listening over the left lung. Diminished. Not absent. Diminished. Exit wound on the posterior left chest, clean, which was better than the alternative. She straightened up and said, to Sandoval directly, left lung sounds are diminished. I'd want a chest x-ray now before we pull the dressing. He's not decompensating, but if there's a hemothorax developing, we'll want ahead of it. Sandoval nodded once. Order it. Get a fast while you're... Already called, Sloane said. The trauma bay moved. The patient's eyes hadn't left Sloane's face. She moved to his right side, adjusting a monitor lead that had shifted in transport. She was close enough that she heard him rather than saw him. A low sound, almost subvocal, that resolved into words after a second. Merritt, he said. She went still, just for half a second. A pause so brief no one else in the room would have clocked it. Don't talk, she said professionally, in the tone of a nurse managing a trauma patient's respiratory effort. But her hands had paused on the monitor lead. He said it again, barely above a breath. Merritt. It's Caldwell. The chest x-ray tech arrived with the portable unit. Sloane stepped back to make room, her face completely neutral, her hands completely steady. Caldwell. Staff Sergeant Daniel Caldwell, 75th Ranger Regiment, 3 years before she left the service. A mission she was never going to describe in any civilian setting, in a valley that didn't appear on any map she'd seen before or after, in conditions that still sometimes surfaced in the specific geography of 3 in the morning. He was not supposed to be here. I was not supposed to be anywhere near Millhaven, Colorado, bleeding through a field dressing in a small regional emergency department during a thunderstorm. And yet, she looked at the X-ray image as it populated on the screen, and she focused, and she did her job, and she did not let any of the rest of it show on her face. Small hemothorax, left lower lobe, she said, to Sandoval, pointing at the image. It's contained right now, but it'll need watching. If his pressure trends down or his sats drop, he's going to need a chest tube. Sandoval was already looking at the image. Agreed. Let's get a repeat BP. It's 108/70, said one of the non-paramedic men, from the edge of the bay. He hadn't been asked. Both Sandoval and Sloane looked at him. "That's his baseline low," the man said. "He usually runs low. Don't let it throw you." Sandoval held the man's gaze for a moment. "And you are?" "His team," the man said simply. "We stay." Sandoval looked like she might argue. Sloane watched her decide not to. The two men, Sloane counted 2 of them in the bay and 2 more just outside the door, which she noted without commenting on, were not soldiers in any conventional visible sense. No uniforms, no identifying insignia. But the way they moved, the way they positioned themselves in the room, the particular quality of their stillness, that was military. That was special operations military specifically. She knew it the way she knew a properly placed field dressing. From experience. She kept working. Caldwell's pressure stayed at 108. His oxygen sat held at 94 on supplemental oxygen. The hemothorax was stable, for now. I was going to need surgery, either tonight or first thing tomorrow, depending on trajectory, but right now he was holding. Sloane stepped back from the bay to chart. She was standing at the workstation outside Bay 2, fingers on the keyboard, when she heard footsteps stop beside her. She didn't need to look up to know who it was. "Why were you in that bay?" Rachel Voss's voice was low and sharp, the restraint of someone who was very irritated and managing it in front of witnesses. "That's not your assignment." "I was available when the trauma came in," Sloane said, not stopping her charting. "Dr. Sandoval used me." "You're not on the trauma team tonight." "No, but the patient needed a nurse and I was there." She kept typing. "His hemothorax is stable, his BP is holding, and the attending is satisfied with the assessment. If there's a process concern, you can raise it tomorrow." Rachel didn't move. "You don't belong in there," she said. Not loudly, just clearly. Sloane stopped typing. She looked at Rachel Voss for 3 full seconds. Not angry, not wounded, just looking, in the way she'd learned to look at things that were true whether she liked them or not. Then she looked back at her screen. "He's alive," she said. "That's what belongs here." She finished her charting. Behind her, from inside Bay 2, through the half-open curtain, she heard Caldwell's voice again. Stronger now, more controlled. The voice of someone whose training was reasserting itself over the biology of shock. "I need to talk to her," he said, to someone in the bay. "The nurse, Merritt. I need to tell them who she is." One of the men said something too low to hear, and then clearer. "You don't know. She's not. You need to understand what she—" And then a monitor alarm sounded, brief and quickly silenced, and then the voices dropped into the clinical register, and Sloane stood at her workstation with her hands on the keyboard and did not move. Outside, the storm pressed against the windows of Hargrove Regional Medical Center. Inside, in Bay 2, a man who knew exactly who Sloane Merritt was had just started trying to say it out loud. And down the hall, Rachel Voss was already walking toward Janet Holt's office, notepad in hand, building the next layer of a case that she had no idea was about to become irrelevant. Rachel Voss was still in motion down the hallway when the second monitor alarm from Bay 2 went off. Longer this time, with a different pitch, the kind that meant something had shifted and not in the direction anyone wanted. Sloane was already moving before the alarm finished its second cycle. She came through the curtain to find Caldwell's oxygen saturation dropping, 94 down to 89 in the span of a minute, his breathing shallower, his color changing at the margins in the way that happened when a contained hemothorax decided to stop being contained. Dr. Sandoval was at the bedside in 12 seconds. The 2 men from his team pressed back against the wall without being told to. They understood the geometry of a medical emergency, understood when their presence was infrastructure and when it was obstruction. "He's decompensating," Sloane said, already reaching for the chest tube tray that she'd staged on the supply cart beside the bay 40 minutes ago, before anyone had asked her to, because the X-ray had told her this was where the night was going. Sandoval looked at the tray, then at Sloane. "Good call." "Left lateral decubitus position," Sloane said, and the second nurse who'd appeared in the doorway, Tiff, wide-eyed but functional, moved to help her rotate Caldwell to the correct angle. What followed was not clean. It was never clean. A chest tube insertion on a conscious patient who had significant pain tolerance and military training and kept trying to say something between the preparation steps was, specifically, the opposite of clean. It was controlled and technically sound, and the outcome was correct, but it required Sandoval's full concentration and Sloane's hands managing three things simultaneously and Tiff holding equipment that kept being needed in a different order than expected. And at one point, Caldwell's blood pressure dropped to 92, and everyone in the room knew it, and nobody panicked because panicking in that moment would have cost more than it bought. 40 minutes later, the tube was placed, the hemothorax was draining, and Caldwell's oxygen saturation had climbed back to 96. He was breathing in the careful way of someone who hurt but was managing it, and his eyes, when Sloane checked his pupils and his level of consciousness, were clear and present and fixed on her face with an expression she recognized as someone trying to communicate something they couldn't say out loud yet. "You're stable," she told him. "The tube is working. Surgery is going to want to see you first thing in the morning, but you're holding." "I need," he started. "Later," she said quietly, close enough that it wasn't for the room. "Whatever you need to say. Later. Right now I need you to just breathe." He closed his mouth. She moved to the foot of the bed to update the chart, and one of the men from his team, the taller one, who had a quality of patience about him that reminded her of the best soldiers she'd worked alongside, the ones who understood that waiting was a form of action, stepped slightly forward and said, at a volume calibrated for only her, "He's been asking for you since before we got here. Once he heard the transmission on the radio and figured out which hospital." Sloane didn't stop charting. "He needs to rest." "Yeah." A pause. "I know who you are, by the way. Not from him. From the after-action report. Carrick Valley." Her pen stopped. Just for a second. "That report is classified," she said. "I know," the man said. "I wrote part of it." She looked at him then, a direct look, the kind she didn't give casually. He met it without flinching, which told her something, and his eyes had the specific quality of someone who had seen significant things and integrated them rather than been flattened by them. "What's your name?" she asked. "Briggs," he said. "Warrant officer. Retired." A small dry note in his voice when he said retired, the way people said it when they meant something more complicated than the word implied. She held his gaze another moment, then looked back at her chart. "Make sure he sleeps," she said. "Yes, ma'am," Briggs said, and he said it without any irony at all, which was its own kind of statement. By midnight, the storm had settled into a steady rain that made the parking lot outside look like a dark mirror, and the ER had de-escalated from the earlier volume spike into the quieter rhythm of overnight shifts, the particular pace of a department that was tired but functional, running on institutional momentum and the kind of low-grade hypervigilance that night nurses developed out of necessity. Sloane was charting at the workstation at the end of the hall when Deborah Solis appeared beside her. Deborah had been on since 6 that morning, which meant she was operating on 17 hours and showing almost none of it. Only in the set of her jaw, a slight increase in the economy of her movements. "Janet Holt wants a meeting tomorrow morning," Deborah said. 8 o'clock, before your shift. Sloane kept her eyes on her screen. "Okay." "She said it's about the trauma bay situation tonight." Deborah paused. "I want you to know I told her you performed appropriately, and that Dr. Sandoval specifically requested your involvement. Thank you." "I'm not trying to manage the situation," Deborah said, with the bluntness of someone who had managed enough situations to be done with pretending. "I'm just telling you what I told her so you have the full picture." Sloane looked at her. "Voss filed another complaint." It wasn't a question. Deborah's expression confirmed it without her having to say so. "She's been building a case for 2 weeks," Sloane said. "This is the escalation." "I know." Deborah's voice was flat. "What I don't know is how to stop it without documentation of performance concerns in the other direction. She's senior. She's been here 9 years. That carries weight." "I've been keeping notes," Sloane said. Deborah looked at her for a moment. "Good. Keep them organized." She paused. "Sandoval is writing up a commendation for the chest tube assist tonight, for your file." Sloane absorbed this. "She didn't have to do that." "No," Deborah said. "She didn't." She left without further comment, which was the most comfort Deborah Solis knew how to offer and which was, in its way, sufficient. Sloane sat with the chart for another minute without looking at it. The commendation would help. The notes would help. None of it would help fast enough if Janet Holt had already decided what the meeting tomorrow was going to accomplish. She pulled up Caldwell's chart and did one more check on his overnight vitals, which were stable, and then she sat back and stared at the ceiling for a moment and thought about Carrick Valley in the way she tried not to think about it at work. Deliberately, briefly, contained. The way you'd open a door just far enough to confirm the room was still there, and then close it again. She'd been 24. The mission had gone wrong in the particular way that some missions went wrong. Not through any single failure of planning or intelligence or execution, but through the compound accumulation of small things going incorrectly in close proximity until the compounding reached a threshold, and then everything accelerated at once. 3 Rangers down in the first 6 minutes, 2 more in the next 4, a valley that was supposed to be clear that was definitively not clear, and Sloane working in a space the size of a large closet behind a rock formation with the equipment she had and nothing else. She'd spent 4 hours in that valley. The scars on her arms were from the 3rd hour. She'd gotten 6 men out alive who would not otherwise have been. 2 of them had required things she didn't like to specify, even in her own mind, because the specificity of it was the part that surfaced at 3 in the morning and took a long time to settle. The Army had given her a commendation she'd never displayed and a medical evaluation she'd navigated with the particular skill of someone who knew exactly what to say to be cleared and then gotten herself discharged as quietly and completely as possible because she had reached the limit of what she could hold and still function. She had become a nurse instead. It was not a coincidence. She blinked at the ceiling and pulled herself back and closed the door and went back to her chart. At 2 in the morning, she heard it. Voices from the direction of Bay 2. Not the low-controlled voices of Caldwell's team, but something with an edge in it, a particular tension that traveled differently than ordinary conversation. She was at the bay before she'd consciously decided to go. Through the curtain gap, she could see Briggs and one of the other men standing angled toward the doorway, and on the other side of the doorway was a man she hadn't seen before, in civilian clothes, dark jacket, an ID badge on a lanyard that he was holding up in the specific way of someone who was used to that gesture working. "I need to speak with the patient," the man was saying. "I have authorization." "You have a badge," Briggs said. "That's not the same thing. I'm from the Federal Coordination Office. The patient is involved in an ongoing classified matter and I need to assess his status." "At 2 in the morning," Briggs said. "The timing is what it is." Sloane pushed through the curtain. All 3 men looked at her. "This is a restricted medical area," she said to the man with the badge. "Patient is post-procedure and resting. Unless you're an attending physician or you have a court order, visitation is at the discretion of the nursing staff, which is me." The man studied her with the practiced blankness of someone accustomed to institutional authority. "I don't believe we've met." "We haven't," Sloane said. "Your badge says Gerald Farr, Federal Coordination. I don't have you on the authorized visitor list for this patient." "I wasn't aware there was a list." "There is now," she said. A long pause. Farr looked at her with the particular assessment of someone recalibrating a situation they'd walked into expecting to control. "I'll come back during visiting hours," he said. "Visiting hours start at 9, Sloane said. Patient's surgical consult is at 7:30. Whether he's available at 9 depends on what that consult determines." Farr put his badge back in his jacket. "I'll be in touch with hospital administration." "That's their department," she said, and held the curtain open in a way that was not quite an invitation to leave, but functioned as one. He left. Briggs looked at Sloane with the specific expression of someone who had just watched something they were going to remember. "That's Farr," Briggs said. "He's been following this situation for 3 weeks. We think he's the reason Caldwell was in the field tonight instead of where he was supposed to be." Sloane processed this. "What does that mean?" "It means someone redirected a training operation in a way that put Caldwell exposed in a location he wasn't briefed to be in." Briggs said it flatly, the way soldiers describe things they were controlled about because the alternative was not controlled. "We don't know if it was incompetence or something else. That's what we're trying to determine." Sloane looked at Caldwell, who was awake. She could see it in his stillness, the particular quality of someone lying very still because they were listening. "He's awake," she said. "He's been awake for about an hour," Briggs confirmed. She moved to the bedside. Caldwell's eyes found her immediately. "You really are here," he said. His voice was rough from the procedure but steady. "I'm the night nurse," she said. "Go back to sleep." "You pulled a needle decompression in Carrick Valley with a 14-gauge IV catheter because we didn't have the right equipment," he said. "You did it one-handed because your other arm was—" He stopped. "I thought you were dead. After. We all thought you'd—" "I wasn't," she said. "I know that now." He was quiet for a moment. Where did you go? Here, she said. I went here. He looked at her for a long time, in the way of someone who is holding many things at once and choosing which one to say. There are people, he said carefully, who are going to want to talk to you. Not far. The others. The people looking into what happened tonight. It goes somewhere, Merritt. It goes somewhere you're going to need to know about. You need to rest, she said. I know. He shifted slightly, winced. But I need you to understand that I didn't know you were here. I didn't come here to complicate your life. You got shot, she said. That's not a choice. Something passed across his face that might have been the beginning of a smile, suppressed by the pain. Still the same, he said. She checked his drainage output, his vitals, his tube placement. Sleep, she said. Surgery is going to want you coherent at 7:30. She stepped back out of the bay and let the curtain fall behind her and stood in the corridor for a moment. Carrack Valley. She had been trying, for 3 years, to put a significant amount of distance between herself and Carrack Valley. She had largely succeeded, the way you could succeed at a thing that was always going to be structurally incomplete, present in the scar tissue on her arms, in the nights that ran differently than other nights, in the calibrated way she moved through spaces and assessed threats, and made decisions under time pressure in ways that her nursing colleagues sometimes noticed and couldn't name. And now Carrack Valley was in Bay 2 with a chest tube and a federal government functionary trying to access him at 2 in the morning, and a warrant officer telling her that the situation went somewhere she needed to know about. She went back to her workstation and charted Farr's visit and her decision to restrict access and the clinical rationale, because she had learned to document everything, and then she sat very still for a few minutes in the particular way she'd learned to sit when the thing she needed was not available and she had to work with what was. The meeting with Janet Holt was at 8 the next morning. Sloane had slept for 4 hours, changed, and arrived at the administrative wing at 7:55 with a folder that contained 11 days of documented incidents, dates, times, direct quotes where available, clinical outcomes where relevant, and a one-page summary organized by category. Janet Holt's expression when she opened her door and saw Sloane waiting was the expression of someone who had prepared for a particular kind of conversation and was now recalibrating. Rachel Voss was already in the office. Sloane registered this without breaking stride. She sat in the chair across from Janet's desk, and Rachel sat to her left, and Janet arranged herself behind the desk with the careful positioning of a person who believed in the symbolism of furniture. "Thank you for coming," Janet said. "Of course," Sloane said. "As you may have anticipated, this meeting concerns some ongoing concerns about your fit within the department." "I've brought documentation," Sloane said, and set the folder on the desk. 11 days of specific incidents with clinical outcomes. I'd also note that Dr. Sandoval filed a written commendation for my performance in the trauma bay last night. I don't have a copy of that in front of me, but it should be in the system. Janet looked at the folder, then at Sloane, then at Rachel. Rachel's expression had done something complicated. "I appreciate that," Janet said. "But the concerns that have been raised go beyond clinical performance." "They are entirely about clinical performance," Sloane said. "Every complaint that's been filed has used clinical language, patient safety, psychological stability, fit for trauma. Those are clinical designations. If the complaints have clinical basis, they should be supported by clinical documentation. If they're not, then what we have is a pattern of harassment by a senior staff member that uses clinical language as cover for personal bias." A silence that had significant weight. "That's a serious allegation," Janet said. "It's a description," Sloane said. "I have documentation supporting it. Does the hospital have documentation supporting the complaints?" Another silence. Rachel shifted in her chair. "This woman came in here with no history, no references anyone could actually verify." "My references are verifiable," Sloane said. "My employment history at Torrance Memorial in New Mexico is on file with HR. My licensure is current and unencumbered in 3 states. If there was a verification problem, I wasn't made aware of it. We weren't able to access certain records." "What records?" Rachel's jaw tightened. "Your military service." The room went still. "My DD-214 was in my application file," Sloane said. "It shows an honorable discharge. The details of my service are not public record. That's not unusual for certain classifications of military work." Which is exactly my point, Rachel said, and she leaned forward slightly, the restraint of 2 weeks of managed antagonism finally finding its outlet. Nobody knows anything about you. You come in here with scars all over your arms, no one can verify your background. You walk into a trauma bay that isn't your assignment. The patient survived, Sloane said. That's not... He survived, Sloane said, again, in the same tone. The hemothorax was managed. The chest tube was placed correctly. The clinical outcome was positive. Is there a question about the clinical outcome? Silence. No, Janet said quietly. Then what are we talking about? Sloane asked. She looked at Rachel, and it was not a look of anger. It was the more uncomfortable look of someone simply requiring an honest answer. What specifically do you believe I did wrong? Rachel stared back at her. Your arms, she said finally. And then, when that landed in the room with the particular ugliness of something said out loud that should have stayed in someone's head, the scars. The way you... I don't know what happened to you, and you won't say, and it makes people uncomfortable, and I have a department to protect. You have been making comments about my scars in front of staff for 11 days, Sloane said. I have dates and witnesses for 7 of those incidents. You've used those comments to build an argument that I am psychologically unfit for this work. The scars on my arms are the result of injuries sustained in active military service. They do not affect my clinical function, and characterizing them as evidence of instability is not patient protection, it is discrimination. The word fell into the room like something dropped from a height. Janet Holt was very still behind her desk. Rachel's face had gone through several expressions and landed on something that looked, for the first time in Sloane's experience of her, like something uncertain. I'd like to give you both time to review the documentation I've provided, Sloane said. She stood. I have the shift in 30 minutes. She picked up the folder, she'd made a copy, and set the copy on the desk and took the original. Sloane, Janet said as she reached the door. She turned. I want to make clear that this hospital does not condone the kind of behavior you've described. Janet looked like someone who was choosing words with the specific care of a person who had just realized the conversation had not gone the direction she'd prepared for. I'll be reviewing the documentation carefully. Sloane nodded once and went to work. The morning shift was ordinary in its demands. A UTI, a small bowel obstruction that needed a surgical consult. A 20-year-old with a broken wrist from a skateboarding accident who kept insisting he was fine in the specific way of people who were not fine. 2 chest pain workups that turned out to be musculoskeletal, and a woman in her 60s with uncontrolled hypertension who cried quietly for 15 minutes before telling Sloane she'd been off her medication for 3 months because she couldn't afford the refill. Sloane flagged the social worker before she finished the conversation. At 11:15, she passed by Bay 2 on her way to the supply room and noted that Caldwell was gone, moved to the surgical unit upstairs, which meant the consult had gone forward and the surgical team had taken him. She didn't stop. She noted it and moved on. At 11:40, Pete Navarro appeared at her elbow. There are military people in the lobby, he said. She looked at him. Not the ones from last night, he said. Different. There are 4 of them in uniform, and there's a civilian with them, and they asked the front desk for the nursing supervisor on duty. Who's supervisor today? Deborah called in sick. Rachel is covering. Sloane was quiet for a moment. What kind of uniform? She asked. Army, Pete said. 2 of them have, I don't know, a lot of insignia, the kind where you can tell it's important even though you don't know what it means. She put down the chart she was holding. Where's Rachel now? She was at the front desk when I came back. She looked... Pete searched for the word. Pale. Sloane walked toward the front of the department. She heard Rachel's voice before she saw her. A different quality than usual. The particular register of someone who had been operating from a position of confidence and had suddenly lost the ground under it. Of course, I can let the director know you're here. Dr. Yuen is available, or I can page. We're not here for the director, a male voice said, measured and authoritative in the way of people whose authority did not require volume. We're looking for a nurse named Sloane Merritt. Sloane came around the corner. There were 4 soldiers in Army service uniforms, 1 colonel, 1 major, 2 sergeants, and a civilian in a gray suit that cost more than most people's monthly rent, carrying a leather briefcase with the particular grip of someone who carried important things regularly. They were standing in the lobby in a loose formation that was not quite at attention but was not casual either. The colonel saw her first. He was a tall man in his mid-50s with the weathered, specific quality of someone who had spent a significant portion of his life in places with limited infrastructure and worse weather. And when he looked at her, his expression shifted in a way that she couldn't read immediately. "Sergeant First Class Merritt," he said. She hadn't been called that in 3 years. "I'm Sloane Merritt," she said. "I go by nurse now." Something crossed his face. Not quite a smile. The kind of expression that acknowledged something was appropriate without fully committing to it. "Colonel Warren Shea," he said. "We're sorry to interrupt your shift." "What's this about?" Rachel Voss was standing 6 feet away, frozen, her tablet held against her chest like a shield. "Two things," Shea said. "First, Staff Sergeant Caldwell is going to be fine. The surgical consult confirmed the hemothorax is resolving and he won't need the OR. We've arranged for his transfer to a military medical facility once he's cleared for transport. He asked us to give you that update personally." Sloane absorbed this. "And second," Shea glanced at the civilian with the briefcase, who stepped forward and produced a sealed envelope. "The incident that resulted in Caldwell's injury is under federal investigation," the civilian said. His name tag said Porter. "During the course of that investigation, your name was identified in connection with a prior incident, Carrack Valley, approximately 3 years ago. There are people at a federal level who are trying to understand the full scope of what happened that day, and there are aspects of that incident that have direct bearing on what happened to Caldwell last night." "I gave a full debrief," Sloane said carefully. "You gave a debrief to a unit that has since been identified as having had a compromised chain of command," Porter said. "There is reason to believe the after-action report from Carrack Valley was not accurately conveyed to oversight. We'd like to hear the record from you, directly." The lobby was very quiet. Rachel hadn't moved. 2 nurses at the station behind her had stopped pretending to work. Pete Navarro was standing very still in the doorway to the main floor. Sloane kept her eyes on Shea. "I'd need to know the legal framework," she said, "and I'd need to know who's asking." She reached into his jacket and produced a second document, a single sheet with a letterhead she recognized, and below it, 2 signatures that she recognized even more specifically, and below those 3 paragraphs that established, in the precise and unambiguous language of people who understood what unambiguous language was for, that the request was coming from a level of oversight that was not in the habit of being questioned. She read it twice. "Okay," she said. Shea nodded. Then he looked at the envelope in Porter's hand. Porter extended it to Sloane, and she took it and felt the weight of it, which was more than a single sheet. "We'll be in Millhaven for the next 48 hours, Shea said, "whenever you're available." "I'll call the number on the letterhead," she said. "That works?" He paused, and for a moment the formality shifted very slightly, and he said in a different register, "What you did in Carrack Valley, the record of it was buried. That was intentional. I want you to know that the people who buried it are part of what this investigation is looking at." Sloane held the envelope. "I appreciate that," she said. Shea nodded. The 4 soldiers and Porter turned to leave. And Rachel Voss, who had been standing 6 feet away for the entirety of this exchange, said nothing, because there was nothing appropriate to say, because the scaffolding of the case she had spent 2 weeks building had just been quietly, efficiently dismantled by people who had never heard her name and had no idea she existed. Sloane tucked the envelope under her arm. She looked at Rachel for a moment. Rachel looked back, and for the first time in 11 days, her expression had lost its architecture. Not remorse exactly, not yet, but the specific blankness of someone whose certainty had just evacuated. Sloane went back to work. 3 hours later, she was in the middle of a wound irrigation on a patient in Bay 5. When Pete appeared at the curtain and said quietly, "You need to see what's happening in the lobby," she looked up. "There are more of them," he said. "More military? And civilians. And someone from the hospital's legal department." He paused. "And Janet Holt is in there, and she looks like she's having the worst afternoon of her professional life." Sloane secured the irrigation dressing, told her patient she'd be back in 5 minutes, and stripped her gloves. She had a feeling the conversation that had started in that lobby this morning was not finished. She had a feeling, more specifically, that it was only now beginning, and that the envelope under her arm, and whatever Caldwell had said to Shea before they came downstairs, and whatever Porter's federal investigation had uncovered about the night in Carrack Valley, were all pointing toward a moment that was going to require her to stop being simply the nurse everyone had decided they already knew and become, again, something considerably more complicated. She walked out of Bay 5 toward the lobby. Behind her, in the room she'd just left, her patient called after her. "You coming back, right? You said 5 minutes." "I'm coming back," she said without turning around. She always came back. That had always been the part nobody understood about her. Not in the valley, not in the years after, not in this hospital where they'd spent 2 weeks deciding she was broken. She came back. That was the thing about her. That was the part that the scars told, if anyone had ever bothered to read them correctly. She pushed through the door into the lobby and stopped. Janet Holt was standing near the reception desk with a man from legal that Sloane recognized by face if not by name. Beside him, holding a different kind of document than the one Porter had produced this morning, was Gerald Farr, the same man she'd turned away from Bay 2 at 2 in the morning, the one Briggs had said was connected to what happened to Caldwell. And Farr was looking at her with an expression that had none of the bureaucratic blankness of their first meeting. He looked instead like a man who had just realized that the nurse he'd dismissed in the middle of the night was standing between him and something he very badly needed to contain. Farr had the particular stillness of someone running calculations. Sloane had seen it before, not in hospitals, not in administrative offices, but in the specific context of people who operated in the space between institutional authority and the things institutions didn't officially do. The stillness wasn't calm. It was the pause before a repositioning. "Ms. Merritt," he said. He dropped the evening's clipped urgency. This version of Farr was smoother, more considered. "I believe we got off on the wrong foot last night. You were trying to access a post-surgical patient at 2 in the morning without authorization," Sloane said. There wasn't much room for interpretation. Farr's mouth did something that was structurally a smile. "I understand that from your perspective, Mr. Farr." This was the man from legal. His name tag said Derek Osai, and he had the look of someone who had been in the building for 11 minutes and had already assessed the situation with a thoroughness that made Sloane marginally more confident in the hospital's legal function than she'd been before. "I've been asked to sit in on this conversation. Whatever you need to discuss with hospital staff, I'd like to be present for." Farr looked at Osei. The calculation happened again, faster this time. "Of course," Farr said. Janet Holt was standing slightly behind Osei in the particular posture of someone who had lost the thread of a meeting they'd thought they were running. She looked at Sloane with an expression that Sloane hadn't seen from her before, not hostile, not managing, just uncertain, the specific uncertainty of someone whose institutional footing had shifted. "I received a request this morning," Farr said, turning back to Sloane, "from the Federal Coordination Office regarding the incident that brought the patient, Caldwell, to this facility. Part of my role is to ensure that individuals connected to this incident are available for proper documentation through the appropriate channels." "There are federal investigators upstairs right now," Sloane said. "Colonel Shea's office contacted me directly this morning with documentation signed at a level that doesn't require your coordination." The smoothness flickered. "The Colonel's investigation is—" Farr started. "I read the letterhead," Sloane said. A pause. "Then you understand," Farr said, and something in his tone had changed, "that the situation is more complex than a single investigative track. I understand that you showed up at 2 in the morning trying to access a patient my team had just stabilized, and that the people actually authorized to investigate this situation told me this morning that you are part of what they're looking at." She said it without heat, the way she would have said a blood pressure reading, factual, specific, irrefutable. "If you have documentation that supersedes what Colonel Shea provided, I'd be glad to review it with Mr. Osei present." Farr held her gaze for a long moment. Then he looked at Osei and said he'd be in touch, and he left. The lobby held the particular quiet of a room that had just cleared of something pressurized. Janet Holt let out a breath she'd been holding. "What exactly is happening?" she said, not to anyone specifically. "I'm not entirely sure yet," Sloane said honestly, "but I think it's better that we document his visit and my response to it." "Already noting it," Osei said, typing into his phone without looking up. He had the energy of someone who found this kind of situation professionally interesting rather than alarming. "Miss Merritt, can you walk me through the 2 a.m. visit from the beginning?" "After my shift," she said, "I have a patient waiting for wound irrigation." Osei looked up. "Right, of course." She went back to Bay 5. The afternoon moved in the compressed, slightly unreal way that afternoons moved after mornings that had contained too much. Sloane worked through her patient load with the focused automaticity of someone who had learned to compartmentalize not as a coping mechanism, but as a functional necessity. The wound irrigation patient was discharged. A new admission came in with acute appendicitis that needed a surgical consult, and a paramedic crew brought in a teenager who'd taken a fall off a roof and had a probable spinal injury requiring careful immobilization and a trauma team response that Sloane was peripherally involved in before being redirected to her own assignment. She was in the medication room at 3:45 when her phone buzzed. The number was local, Millhaven Exchange. She didn't recognize it. She answered. Merritt, Briggs's voice. Caldwell's been moved to a holding room on the 3rd floor, surgical unit, room 318. He's asking to see you when you have a break. But that's not the main reason I'm calling. She turned slightly away from the door. Go ahead. Farr made 2 phone calls after he left the hospital. We have reason to believe one of them was to a contact in the state licensing board. She was quiet for 3 seconds. Licensing board, she said. Someone is going to file a complaint against your nursing license, Briggs said. Not through the hospital, directly to the board. It'll claim improper clinical judgment, unverified credentials, specific incidents. It's designed to pull you out of the picture before you can formally debrief with Shay's team. She absorbed this. How confident are you? Confident enough that I'm telling you. Timeline? Could be as fast as 24 hours. Board complaints move slow on normal days. But if the right person makes the call, it can get expedited. She thought about her documentation folder, about the commendation Sandoval had filed, about 11 days of notes with dates and times. Okay, she said. That's it, okay? What would you like me to say? A pause. Caldwell wants to see you. I'll come up at shift end, she said. 6 o'clock. She hung up and finished pulling the medication she'd come in here for and went back to her patient. At 5:15, Rachel Voss found her. Sloane was at the workstation, updating a chart, and she heard Rachel before she saw her. The particular footfall of someone who had been working up to a conversation for a while and had finally committed. She sat down at the adjacent workstation without asking, which in a different context would have been ordinary, and in this one had a slightly different texture. Sloane kept charting. I know about the licensing complaint, Rachel said. Sloane looked at her. That was fast. Farr called someone I know. Rachel's voice had lost its performance quality. Not warm, but stripped of the professional gloss. Just a person talking. He was asking about your clinical incidents over the last 2 weeks, asking for anyone who had observed your performance and could speak to concerns. Rachel was quiet for a moment. I told him I'd think about it. But you called me instead. I haven't decided anything yet, Rachel said, with the stubbornness of someone who didn't want their motivations read too clearly. I'm telling you what I know. Sloane turned in her chair to face Rachel more directly. Rachel Voss, up close and without her structural authority, was a woman who looked like she hadn't slept well. The particular tiredness of someone who'd spent the night with an uncomfortable thought. The comment from the lobby meeting had not left the room, Sloane understood. They thought the scars were evidence of something broken. Said out loud, in front of witnesses, it had become available in a way that interior cruelty never quite is. What do you want from me? Sloane asked. I don't... Rachel stopped, started again. I want to know if what Shay's people said is true. About your service. What specifically? That you were... what they implied. Special Operations Medical. That the scars were from... She didn't finish. From doing my job, Sloane said. Rachel looked at the workstation surface. I said some things. In front of people. About you being... about the scars being evidence of... She stopped again. The sentence didn't seem to want to complete itself when she was facing the person it had been about. Yes, Sloane said. You did. I was wrong, Rachel said. Flat. The kind of apology that wasn't quite an apology yet, but was the material one was made from. About what I thought the scars meant. You were wrong about what you thought they meant, Sloane said. But the problem wasn't the assumption you made about them. The problem was that you used them, whatever you thought they meant, to try to remove me from my job. That's the part that mattered clinically. Rachel looked at her. The patient last night, Sloane said. If you'd succeeded 2 weeks ago, if I'd been pushed out when you started filing complaints, he would have come in during a shift where I wasn't there. That's not sentiment. That's math. Rachel didn't respond. If Farr calls you back, Sloane said, and if what Briggs told me is accurate and there's a licensing complaint being constructed, do what you need to do. But I want you to think about what you actually observed, clinically, over 11 days. I observed you doing your job correctly, Rachel said quietly, every single time. Then that's what you have to work with, Sloane said. She turned back to her chart. Rachel sat there for another moment. Then she left without saying anything else, which was the right call under the circumstances. There wasn't anything else to say that would have been more useful than leaving. Room 3A8 was a standard surgical unit room that smelled like antiseptic and the particular recycled air of floors that never got full natural ventilation. Caldwell was upright in the bed when Sloane arrived at 6:03, still in his hospital gown, but with better color than the previous night, and Briggs was in the chair beside him doing something on a phone that he put away when she came in. "You look better," she said to Caldwell. "I've been worse," he said. She checked his drainage output on the chart at the foot of the bed, decreasing, which was correct, and looked at his most recent vitals on the monitor. Stable. The surgical team had apparently been satisfied. "Briggs told you about Farr," Caldwell said. "Yes." "Farr is not the primary problem," Caldwell said. "Farr is the instrument. The problem is the person who's been directing him, and that person is the same one who redirected our training operation 3 weeks ago in a way that put me in a location I was never supposed to be in, and whose name appears in the chain of documentation from Carrack Valley." He said it with the directness of someone who had decided that being indirect was no longer worth the energy. "His name is Colonel Harlan Drews. He's currently attached to a federal oversight committee reviewing special operations medical protocols." Sloane went still. "Drews?" she said. "You know the name." "He was in the debrief chain," she said, "after Carrack Valley. I never met him directly, but his name was on the summary documentation that came back to me afterward. The summary that said 3 of the 6 survivors were in stable condition when they were extracted," Caldwell said. "They weren't," Sloane said. 2 of them were critical. The documentation was wrong. "The documentation was deliberately altered," Caldwell said. "Drews's office made changes after the fact. The reason is complicated. There's a contracting situation involved, a medical equipment manufacturer, some decisions that were made about what equipment was deployed in the field that day. But the short version is that Carrack Valley produced outcomes that contradicted the readiness claims of a program Drews had financial interest in supporting. So the record was changed to show the outcomes were less severe, less in need of the kind of improvised field response you provided." The room was very quiet. Sloane had a very specific sensation. Not quite anger, not quite the vindication of something finally named, but the complicated cognitive experience of a truth you'd suspected for a long time being confirmed in a form you couldn't unknow. "He's been trying to suppress anyone who could contradict the record," Caldwell said, "which includes me because I filed an internal complaint about the equipment 6 months ago, and it includes you, if anyone figures out you were there." "Farr figures I'm there," Sloane said. "Farr figured it out the same night I came in," Briggs said from the chair. "When Caldwell said your name in the trauma bay, Farr had contacts at this hospital by the next morning." "Rachel Voss," Sloane said. "Farr identified her as someone with existing motivation to provide negative information about you," Briggs said. "He gave her a direct line." Sloane looked at the window. Outside, Millhaven's North Ridge was doing what mountain ridges did in early evening, going dark at the top while the valley still held light, the demarcation between the 2 zones moving slowly downward. "Shay's investigation," she said. "How close is it?" "Close enough that Drews is moving fast," Caldwell said. "The licensing complaint is designed to do 2 things: pull you off the floor so you're not clinically credible, and create a paper record of performance concerns that makes it look like your account of Carrack Valley is from an unreliable source." "When does Shay want me?" "Tomorrow morning," Briggs said. "He cleared space at 0800, but Farr knows that timeline too, which means whatever move he's going to make, it's going to come tonight." Sloane looked at Caldwell. "What do you need from me?" she asked. "Your account of Carrack Valley," he said. "Specifically the equipment failures. Specifically what you improvised, why you had to improvise it, and what that means about the readiness claims for the program Druce was supporting. He paused. You're the only person who was there who can speak to it directly. The other survivors, some of them have been pressured. Some of them have just moved on and don't want to go back to it. You're the one who was in the worst of it and came out with the clearest memory. Because I wrote it down, she said. He looked at her. Afterward, she said, I wrote the whole thing down. Every procedure, every decision, every piece of equipment, every failure, date, time, clinical detail. Not for any official record, just because I needed to. She paused. It's in a safe deposit box in Denver. Caldwell's expression shifted into something that might have been relief and might have been something more than that. That, Briggs said carefully, is extremely good news. She left the hospital at 6:45 and drove to her apartment, which was a second-floor unit in a building 3 blocks from the hospital that she'd chosen because it was close enough to walk in an emergency and had good sight lines from the entrance. She'd been living there for 2 weeks out of boxes she hadn't fully unpacked, which felt, in retrospect, like an instinct that had known something the rest of her hadn't caught up with yet. She made coffee and sat at the kitchen table with her phone and called the number on the letterhead Colonel Shea had given her. He answered on the second ring, which told her something about how he was operating. Merritt, she said. I understand we have a more specific problem than this morning. Far, Shea said. It wasn't a question. I have a document in Denver that you'll want. I can be there and back in 4 hours. We can have someone meet you. No, she said. I go alone. I pick it up alone. Nothing about that location gets passed to anyone outside this call. A brief pause. Understood. Has the licensing complaint been filed yet? As of 2 hours ago, no, but our contact at the board flagged that there's an inquiry request pending. It hasn't been assigned yet, which means there's maybe a 12-hour window before it enters the formal process. 12 hours is enough, she said. She drank half her coffee and changed out of her scrubs and got her car keys. The drive to Denver was 4 hours on a good day and 3.5 if the mountain passes were clear, which tonight they were. The storm had pushed through and left the air cold and sharp and the road visibility clean. She drove with the radio off again, the same way she'd driven into Mill Haven 2 weeks ago, and she thought about Carac Valley with the door open this time, letting it stay present rather than managing it at distance, because she was going to have to speak it out loud tomorrow, and the speaking required the memory to be accessible rather than contained. 4 hours in a valley, 6 men. Equipment that failed in the specific, documented ways that told you something had been wrong before the mission started. A 14-gauge Ivry catheter used for a procedure it was not designed for because the correct equipment was not there, and the not being there was not an accident of supply chain or field conditions, but a decision made by people operating at a level that never touched the ground. She'd saved 6 men with what she had. What she had not been what she should have had. The difference between those two things was the entire story, and it was in a safe deposit box at a bank on the east side of Denver in a folder she'd put there 2 months after her discharge. On the same day she'd filed her nursing school application, when she'd decided she was done carrying it alone and needed somewhere to put it that wasn't her own memory. She arrived at 11:40. The bank was closed, obviously, but she had 24-hour box access through a side entrance with a biometric lock, which she'd specifically requested when she'd set up the box. She was inside for 6 minutes and out again with a manila folder that was not thick, maybe 40 pages, but was specific and dated and in her own handwriting on the kind of field notebook paper that didn't look like anything important but was. She was back in Mill Haven by 3:30 in the morning. She sat in her car outside the hospital for 10 minutes, not because she needed to. She wasn't going back in tonight, but because the building had a particular quality in the dark that she hadn't noticed before, lit in the windows where the overnight shift was moving. Ordinary and relentless in the way of hospitals, which never stopped regardless of what happened inside them. Patients who needed things, staff who provided them, the whole apparatus of keeping people alive turning over continuously. She had walked into this building 2 weeks ago wanting quiet. She had not, she acknowledged, sitting in her car with a 40-page field notebook on her passenger seat, gotten quiet. She'd gotten something else, something that felt less like what she'd planned and more like what she'd been working toward without knowing it. She went home and slept for 3 hours and was back at the hospital at 7 for a shift that started at 7:30. So She's team was using a conference room on the administrative floor, which Sloane found slightly ironic given that the administrative floor was where Janet Holt's office was, though Janet herself was not visible when Sloane came off the elevator at 7:55. The conference room had been set up with a recording setup that was more sophisticated than it looked. 3 field-grade military officers, Porter the civilian, a woman who'd been introduced as a federal prosecutor named Agent Diane Yee, and a technician managing the recording equipment who looked 23 and had the focused expression of someone who understood that what they were recording mattered. Shay stood when she came in. "Good morning," he said, with the brevity of someone for whom mornings were a fact rather than a social occasion. She set the folder on the table. Yee leaned forward. "Is this?" she started. "My account of Karak Valley," Sloane said. "Handwritten, dated the day I wrote it. Clinical procedures, equipment inventory, deviations from standard protocol, and documented reasons for them. It cross-references the official after-action report in 3 places where the official record is incorrect." Yee opened the folder. The room went quiet in the particular way of rooms where something important has just arrived. "For 27 minutes, Yee read. Shea read over her shoulder for part of it. The major across the table read the pages as Yee set them down. Nobody said anything that wasn't directly procedural. Then Yee looked up. "Ms. Merritt," she said, "I need to ask you to walk me through this in detail, starting from the point of mission compromise." "I know," Sloane said. She started talking. She talked for 2 hours and 11 minutes, with 2 short breaks, answering questions from Yee and Shay and occasionally the major, providing the level of clinical and tactical specificity that she had held for 3 years in the particular container of the notebook and her own memory. The equipment that hadn't been there. The equipment that had failed. The improvised solutions, each one with a clinical rationale she could still articulate precisely because necessity had burned them into the kind of memory that didn't fade. The outcomes. The specific, demonstrable gap between what the program's readiness documentation claimed and what she had encountered on the ground. She did not perform this. She did not make it dramatic. She stated it in the flat and accurate register of a clinical record, because that was the register in which it had happened, and it deserved to be represented honestly. At 10:17, Yee's phone buzzed. She looked at it, and her expression shifted in a way that made the room shift with it. "What?" Shay said. "Farr just entered the building," Yee said. "He's downstairs. He has a federal marshal with him and an emergency injunction." Shay was already on his feet. "On what basis?" "The injunction is targeting this interview," Yee said, reading. "On the basis that the subject, Merritt, is currently under active review for nursing license violations, making her testimony in an active federal investigation potentially compromised." She looked up. "It's thin, but it's enough to pause the recording if a judge signs it." "Has a judge signed it?" the major asked. "Not yet. It's an emergency application. They'll have it in front of a duty judge within the hour." Sloane looked at the stack of pages on the table. "Does the injunction cover written documentation I provided voluntarily before the session began?" she asked. Yee looked at her. A pause of about 4 seconds, in which Sloane watched the prosecutor work through the question. "No," Yee said. "If the document was provided prior to the interview commencing, it's already in evidence. The injunction, even if granted, would cover verbal testimony going forward but wouldn't retroactively pull submitted physical evidence." "Then everything in the folder stands," Sloane said. "Yes. And the folder contains the 3 specific equipment failures and the clinical improvisation record." "Yes." "Then even if they stop the interview," Sloane said, "you have what you need to contradict the official record." Yee looked at her for another moment. Then she looked at Shay. "She's right," Shay said. Yee was already on her phone. Sloane sat back in her chair. Downstairs in a lobby where 2 weeks ago she had stood and been introduced to Colonel Shay, Gerald Farr was holding an injunction that had arrived 40 minutes too late to matter, which he did not yet know, and which someone in the next few minutes was going to have to tell him. She thought about the folder, about the night she'd written it, sitting in a motel in New Mexico 2 months out of the service, in a room with thin walls and a heater that clicked, writing in a field notebook with a ballpoint pen about the things she had done and the things she had used and the things that had not been there and should have been. She'd written it for herself because the weight of it had needed somewhere to go. She hadn't written it thinking it would ever matter to anyone except her. She was, it turned out, wrong about that. Yi's call was brief and clipped. When she hung up, she turned to the technician. "Keep the recording running." The technician nodded. "They're coming up," Yi said to Shay. "Let them come," he said. The door to the conference room opened 40 seconds later. Not far, but a woman Sloane didn't recognize, in civilian clothes with a government badge, who said to Yi, "We have an emergency injunction application." "I know," Yi said. "Has it been signed?" A pause. "Not yet." "Then it's an application," Yi said. "We'll continue." The woman looked at Sloane, then at the folder on the table. "Is that—" she started. "Evidence," Yi said. "Already submitted." The woman's face did something complicated, and then, behind her, in the doorway of the conference room, Gerald Farr appeared. He looked at the table, at the folder, at the 40 pages of Sloane Merritt's handwriting, clinical and precise and dated 3 years ago. His face, for just a moment, showed the specific expression of someone who has understood that the thing they came to prevent has already happened. Sloane met his gaze. She felt very steady. Not triumphant. That wasn't the right word. Just steady, in the way of someone whose weight had finally landed on solid ground after a long time operating over uncertain footing, and whose arms, beneath their sleeves, held the record of exactly what that ground had cost. "Colonel Drews authorized you to file that injunction," she said, to Farr, in the same flat register she used for clinical facts. "And Colonel Drews's name is now going to appear on record as the individual who attempted to suppress testimony about Karak Valley." Farr said nothing. "That's going to be a problem for him," Sloane said. "And for you. From somewhere below them, from somewhere in the hospital's ordinary operational noise, monitors and PA announcements, and the background hum of a building full of people being kept alive. A sound reached the conference room that stopped everyone in it. A rapid response alarm. The tone was specific. 3rd floor. Room 31 Teat. Caldwell's room. Sloane was already out of her chair. She hit the stairwell at a run. Not the elevator. The elevator added 30 seconds minimum, and 30 seconds in a rapid response situation was the difference between a recoverable event and something that wasn't. She took the stairs from the administrative floor to 3 and 18 seconds, which she registered without thinking about it, and came through the stairwell door into the 3rd floor corridor at a speed that made the ward clerk at the nursing station look up sharply. Room 318 had 3 nurses already in it, and the rapid response team arriving from the other direction. A physician, a respiratory therapist, a pharmacist, the assembled cross-functional machinery that hospitals deployed when a patient crossed a threshold. Sloane came in behind the response team and assessed in the first 4 seconds. Caldwell was upright in bed, which was wrong for what she'd expected, and Briggs was standing against the wall with his arms crossed, and his expression doing something she couldn't immediately classify. The monitor showed a heart rate of 128, blood pressure 88/54, oxygen saturation 91. That was not a crash. That was a patient whose numbers had deteriorated fast enough to trigger the alarm, but who was conscious and breathing, and whose eyes, when they found Sloane across the room, were present and tracking. His chest tube output dropped to almost nothing over the last hour. The surgical resident, a young man named Dr. Farkas, who Sloane had seen on rounds, was saying, "And then his pressure tanked. We need to rule out clotting in the tube." Sloane moved to the right side of the bed, the nursing side, and looked at the drainage system. The tube was in place, the connections were intact, and the drainage chamber had maybe 5 milliliters in the last hour, compared to 30 in the hour before that. "When did the position change?" she asked. Farkas looked at her. "What?" "His position in the bed." She looked at Briggs. "Was he moved in the last 90 minutes?" Briggs's expression shifted. "About 2 hours ago. The orderly repositioned him, said it was for pressure relief." "Which orderly?" "I didn't. He was a guy I hadn't seen before. 40s, gray scrubs." Sloane looked at the tube position, then at the dressing over the insertion site, then at Caldwell. "Pain change when they moved you?" she asked him. "Yeah," he said tightly. "Sharp. I figured it was normal." She looked at the tube angle. "The tube is migrated," she said to Farkas, clearly enough for the room. "The drainage holes are partially out of position. Look at the external markings versus where the tape is. Someone moved the tape. The tube's been repositioned from the outside." The room went quiet in a specific way. Farkas leaned in, looked at the markings, looked at the tape. His face did the thing faces did when something that should have been normal became something else. That's, he started. It didn't migrate on its own, Sloane said. The tube was manipulated. He's reaccumulating fluid because the drainage position is wrong. She looked at Farkas directly. He needs the tube repositioned now, and I need you to secure this room. Secure it how? No one in or out who isn't on the surgical team or the response team, she said. Call Dr. Sandoval. Farkas looked at her. The brief, compressed look of someone deciding how much authority to grant a nurse from a different floor who had just walked into his patient's room. And then something in Sloane's expression apparently resolved the question, because he reached for his pager. Sloane looked at Briggs. Where are the other two? Outside in the hallway, he said. He was already moving toward the door. One of them description matched that orderly to anyone in the hospital system, she said. I need to know if he's actually employed here. Briggs was through the door. She turned back to Caldwell and the repositioning work, and what followed was not clean but was fast. She and Farkas and one of the rapid response nurses working through the procedure of correctly placing the tube drainage position, Caldwell gritting through it without making the kind of noise that would have been entirely understandable. His blood pressure sitting at 86 and making everyone in the room aware that they were working against a timeline that had its own opinion about how long this could take. 14 minutes later, drainage had resumed. His pressure started climbing at minute 17, 91, 94, 98. And by minute 22, he was back at 106 and his oxygen saturation had climbed to 95. And the room's respiratory quality changed in the way it did when the immediate crisis had passed and the next problem became available. Sandoval arrived at minute 19, took in the scene, looked at the tube markings, and said to Farkas flatly, "That tape was moved." "Yes," Farkas said. "Is this documented?" "I'm documenting it now," Sloane said, from the chair where she was writing with the handwriting of someone moving fast, but making it legible, because legibility was going to matter. Sandoval looked at the documentation in progress, and then at Sloane, and then, briefly, at the ceiling, in the way of someone performing a rapid internal calculation about how many separate crises they were managing simultaneously. "I'm calling security," Sandoval said, "and I'm calling Shea's people." "Briggs is already on it," Sloane said. Sandoval absorbed this. "Of course he is." The unidentified orderly was identified within 40 minutes. His name was not in the Hargrove Regional Employment System. His badge, which Briggs had managed to photograph from the hallway footage that one of the other members of Caldwell's team had reviewed, was a convincing reproduction of a hospital ID that would have passed casual inspection, which was exactly what it had been designed to do. Shea's team had the footage by 10:58. By 11:20, they had a name cross-referenced from a federal database. And by 11:40, two of Shea's people were in a room with the Millhaven Sheriff's Department, explaining the situation in the careful way of people who needed local cooperation without sharing everything they knew. Sloane was back on her regular floor by 11. She wasn't formally assigned to the surgical unit, and Caldwell now had two of Shea's people in the hallway outside his room plus Briggs, which meant the immediate physical risk was managed. And she was standing at the workstation trying to make the last 4 hours fit into the shape of documentation when Pete Navarro appeared at her shoulder. "Rachel's in Janet's office," he said quietly. "She's been in there for 40 minutes. Sloane kept typing. "Okay." "I don't know what they're talking about." "I have a guess," she said. She finished her charting and got up to check on a patient who needed an antibiotic bag changed and did the rest of her morning work with the focused movement of someone who had learned that the most effective response to a situation spiraling outward in multiple directions was to do the immediate thing in front of you correctly, because the immediate thing in front of you was also a person, and the person deserved the same attention regardless of what was happening in conference rooms and administrative offices and sheriff's departments. The antibiotic patient, an older man named Mr. Delgado, who was recovering from a post-surgical infection and had been at Hargrove for 6 days, asked her if she was okay. "I'm fine," she said. "Why?" "You've got that look," he said. "My wife gets it. Like you're somewhere else, but you're not letting yourself go there." "I'm here," she said. "I know you are," he said. "That's what I mean. You're making yourself be here." He paused. "Whatever's going on, it's okay to be somewhere else for a minute. Nobody's falling apart in the next 60 seconds. She looked at him. He was 71 and had a post-op infection and a wife who recognized that look. And he had just offered her something with a simplicity that made it harder to deflect than more elaborate kindness would have. "Thank you," she said, and meant it in a way that didn't require elaboration. She finished his medication and moved on. Janet Holt found her at 1 o'clock. Sloane was in the break room eating half a sandwich she'd brought from home, which she'd been eating in 3-minute increments between tasks for the last 2 hours, and Janet knocked on the open door with the knock of someone who had been practicing what they were going to say. "Do you have a few minutes?" Janet asked. "I have whatever's left of this sandwich," Sloane said. Janet came in and sat down across from her, which was a different posture than the previous meetings. Not behind the desk, not with the furniture doing the positional work. Just a person at a table. "Rachel spoke to me this morning," Janet said. "I know." "She retracted the complaints she filed, all of them." Janet folded her hands on the table's surface. Not the desk power gesture from before, but something that looked closer to someone who wasn't sure what to do with their hands. "She also told me about Farr contacting her, and what she said to him." "Which was?" "She told him she had no documentation of clinical concerns that she could stand behind." A pause. "She said she told him that because it was accurate." Sloane took a bite of her sandwich. "She also told me what you said to her," Janet said, "about the patient last night, about if you'd been removed 2 weeks ago." "That wasn't strategic," Sloane said. "It was just true." "I know." Janet was quiet for a moment. "I handled this badly. The way I responded to the initial complaints, I was operating from the wrong framework. I was treating it as an HR management situation, and it was something else. It was a person trying to do her job," Sloane said, "while another person tried to take it away based on what my arms look like." "Yes," Janet said, "that's what it was." The directness of it seemed to cost Janet something, which meant it was probably honest rather than managed. "The hospital's legal department is going to reach out to you," Janet said, "about the licensing complaint. OSE has filed a formal response to the board on behalf of the hospital, supporting your record here. He's also flagging the connection to Farr, which, legally, a government operative using a hospital employee to construct false performance documentation in connection with suppressing federal testimony is something the board takes an interest in." "That should help," Sloane said. "It should do more than help," Janet said. "It should end it." She stood to leave and then stopped. "The scars," she said. Not in the way Rachel had said it, not with the machinery of implication, just the word and a pause. And then, "I should have asked at the beginning. I should have." The complaint language talked about psychological stability, and She stopped. "I didn't ask what they were from." "No," Sloane said. "I'm asking now. If that's—" "Military service," Sloane said. "Injuries sustained in the field." She paused. "They don't affect my work." "I know that now," Janet said. She left. Sloane ate the rest of her sandwich. At 2:30, the name Colonel Harlan Drews entered the visible record of the investigation for the first time. She found out through Shay, who called her between patients with the brevity of someone conveying essential information in the minimum necessary words. Drews had been formally named as a subject of the federal investigation. His access to the Oversight Committee had been suspended pending review, and Farr's emergency injunction application had been withdrawn before a judge ever saw it. Apparently someone in Farr's chain had made a calculation about what happened to injunctions, whose basis was subsequently disclosed as part of a federal investigation. "The notebook," Shay said. "Yee's team has been through it. The 3 equipment failures you documented are directly contradicted by the program readiness reports that Drew's office submitted after Carrick Valley. The contradiction is specific enough to constitute evidence of falsification." "What happens next?" she asked. "That's Yee's territory," he said. "But the short answer is that what you wrote 3 years ago, sitting in a motel somewhere, is going to be the document that the falsification charge is built on." She was quiet for a moment. "Caldwell," she said. "The orderly, there a Drews connection?" "Being established," Shea said. "Farr and Drews had a phone communication 40 minutes before that orderly entered Caldwell's room. We don't have content yet, but the timeline is going to be difficult for either of them to explain." "That's attempted interference with a patient in a medical facility," Sloane said. "Among other things," Shay said. "Yes." She went back to her patients. The afternoon brought its own texture. Word moves through a hospital the way it moves through any closed community. Not all at once, but in the specific wave pattern of information that is too significant to not discuss, but too complex to relay accurately in hallway increments. By 3 o'clock, the broad outlines of what was happening, military investigation, federal involvement, a connection to Sloane that nobody could quite specify, had reached most of the day shift in the blurred, approximate form that hallway information always took. She felt it in the way people looked at her, not the old way, the sideways, assessing look of people who had already decided and were just confirming. This was different. This was the look of people who were revising, which was its own uncomfortable thing to receive. Revision required acknowledging a prior error, and acknowledging a prior error in a public way was something most people preferred to do slowly, with minimal witnesses. Tiff, who had never been malicious, just susceptible to the social current that Rachel had been generating, stopped Sloane in the hallway mid-afternoon and said, with the stumbling directness of someone who had been working up to it, "I'm sorry about the things I said in the first week. About your arms. I repeated what I heard, and I shouldn't have, and I'm sorry." "I know," Sloane said. "That's it? Just, I know?" "You heard something and you repeated it," Sloane said. "That's how it works. You can do different next time." Tiff looked at her for a moment. You're not even angry." "I'm tired," Sloane said. "There's a difference." She moved on. Rachel herself she did not see until almost the end of shift, 4:45, near the medication room, a brief intersection in the corridor that neither of them had planned. Rachel looked like someone who had spent the day inside a difficult reckoning and was still inside it, not through and out the other side. Her face had the quality of something in progress. She didn't say anything elaborate. She just stopped and looked at Sloane and said, "I told Farr I had nothing, and that's true. But I also, before that, I built it. The climate. I know that." "Yes," Sloane said. "I don't know why, exactly. That's the part I'm—" She stopped. "You came in here and you were just good at the job, and I didn't—" "You don't have to explain it to me," Sloane said. "You have to understand it yourself." Rachel was quiet. "The patient in 318, Sloane said. Someone tried to hurt him this morning. Not a nurse, not a hospital error. Someone from outside who got in with a fake badge because the situation around him was chaotic enough to allow it. He's alive because I was here and because I caught what they did in time." She held Rachel's gaze. "That's what the last 2 weeks were about, from where I was standing. Not the complaints, not the meetings, that." Rachel didn't respond. Sloane went to finish her shift. At 5:50, she was at the workstation completing her final documentation when Briggs appeared in the department, not in the way of a person with a medical need, but with the directed movement of someone who had come specifically to her. "Druce is in Denver," he said when he reached her. "He's been at a federal building since this morning. Yee's people picked him up approximately 90 minutes ago for what they're calling a voluntary interview, which we both know is the preliminary to something less voluntary." "And Farr?" "Farr is with Millhaven Sheriff's Department right now," Briggs said. "Cooperating. He's been cooperating since about noon, which tells you the calculation he made about where this is going." She absorbed this. "Caldwell," she said. "How's his drainage looking?" Briggs registered the shift in subject without reacting to it. "Increasing again. Farkas says if it stays on this trajectory, he'll be cleared for transport in 48 hours. "Good. He wants to see you before he goes." "I know." "Merritt." Briggs paused, in the specific way of someone who was choosing between several things to say and picking the right one. "What's coming?" "From the investigation. The way this resolves. It's going to put your name on record in a way you've been avoiding. Yee's going to want you in a formal proceeding. Testimony. The whole thing is going to be on record." She'd known this was coming. She'd known it from the moment she'd pulled the notebook out of the safe deposit box and driven back to Millhaven at 2 in the morning. The decision to bring it had been the decision to become visible, and she'd made it with her eyes open. "I know," she said. "Are you—" "I'm fine, Briggs." He looked at her with the particular expression of a man who had seen a lot of people say they were fine and had learned to read the difference between the kinds. "Okay," he said. "For what it's worth, I think you've been fine for a long time. I think people just kept not noticing." She looked at him. 3 years is a long time to be fine alone, he said. It was the most he'd said about any of it. She let it land without deflecting, which was the only honest response. Go check on Caldwell, she said. He went. She turned back to her documentation and finished it, the last entries of a shift that had been approximately 4 different shifts compressed into one, and she sat for a moment after she was done, in the particular stillness of someone whose body knew it had been running hard and was beginning to negotiate the transition to something slower. The ER around her was in its mid-evening rhythm, the post-dinner volume bump, the familiar sound of triage happening at the front desk, Pete Navarro moving through the department with his systematic double-checking of everything, the PA system calling in the background. Ordinary. Relentless. Exactly what it had been before any of this started. She was about to gather her things when Janet Holt appeared in the department entrance and walked directly to her, which had the quality of something deliberate. I need to tell you something, Janet said, and I want to tell you before you hear it another way. Sloane waited. Rachel Voss submitted her resignation this afternoon, Janet said, effective immediately. She said she had created a hostile work environment and that she didn't think her continued presence served the department. Janet paused. She asked me to tell you that it wasn't... She stopped, looked for the word. She said it wasn't adequate. As a way to make things right, she knows that. But it was what she had. Sloane processed this. Did you accept it? She asked. I accepted it, Janet said. Given everything, the complaints, the far contact, the pattern over 11 days, I don't think there was a viable path to her continuing here. But I want you to know she came to me. She chose it. Okay, Sloane said. She thought briefly of the woman who had said, "You never asked my story." That line that she'd imagined in her head over the last 2 weeks as the thing she might say if given the opportunity. She didn't feel the satisfaction she might have expected from Rachel's departure. She felt something more complicated, the awareness that the person who'd caused the last 2 weeks of this was also a person, and that people who caused damage usually had reasons that didn't excuse the damage but existed anyway. She was glad Rachel was gone. She also wasn't glad about everything that required. Those two things sat beside each other without resolving, which was how most true things worked. She went to see Caldwell at 7. He was better, upright, more color, his drainage back to an appropriate rate, eating something from a tray that he didn't look enthusiastic about, but was clearly working through because he knew he needed to. Sit down, he said when she came in. She sat. They were quiet for a moment in the way of people who had been through something together, not all at the same time, but with enough overlap that the experience was shared rather than parallel. Briggs told me about the notebook, Caldwell said. I've thought about Carrack Valley almost every day for 3 years, he said. Not all of it, specific parts. He was looking at the window, not at her. There were 6 of us who came out. You know that. One of them, Hartfield. You remember Hartfield? Yeah, she said. He was out of the army within a year. He's okay. He's got a landscaping business in Georgia and 2 kids, and he's okay. But he was the worst one, physically. The worst case. And I've always thought that if the equipment had been there, if Druce's program had actually delivered what it claimed, Hartfield wouldn't have been the worst case. He would have been a manageable case. She didn't say anything. What you did kept him alive until extraction, Caldwell said. But what you had to do to keep him alive, what the absence of the right equipment required, that's on the document record now. Yes, she said. That's going to matter, he said, in the proceeding. That's the thing that goes from being your memory to being the record. She knew. She'd known it in the motel room in New Mexico when she'd written it down, even though she hadn't known yet exactly what knowing it would require. I need to ask you something, Caldwell said. He turned from the window and looked at her. When you transferred here, Millhaven, specifically, random? She considered the question seriously. I drove through it once, she said. 6 months before I applied. I was on my way somewhere else, and I stopped for gas and I ate at a diner that had green chile that was actually good, and I thought, this place is quiet. And I needed quiet. He looked at her. I didn't get quiet, she said. No, he agreed, but I got... She thought about the right word. I got something to stand on, she said. That's not the same thing, but it might be better. Caldwell was quiet for a moment. Then he said, The surgical team said I might need one more imaging study tomorrow before they'll clear me, which means I'm here until at least day after tomorrow. I know, she said. I'll check on you in the morning. You don't have to. I know I don't have to, she said. She stood and looked at his chart and looked at his vitals on the monitor and updated her mental record of his status, improving, stable, on trajectory. And then she looked at the man himself, who had been shot during a training operation that was redirected by someone trying to suppress a record, and who had asked for her in a hospital lobby in Millhaven, Colorado, and whose presence here had set in motion the sequence that had produced the last 48 hours. Thank you, he said, for the debrief, for the notebook, for all of it. You got shot, she said. That started this. Something would have started it eventually, he said. It was going to come to a point. The only question was whether you were going to be in it or not. She thought about that. Get some sleep, she said, and left. She was in the elevator going down when her phone buzzed. Yi's number. She answered. Miss Merritt. Yi's voice had the compressed quality of someone calling between steps in a process that was moving fast. I need to give you a heads up. Druce, in the interview this afternoon, provided information in exchange for a reduced cooperation agreement. Some of what he provided is about you. Sloane stared at the elevator doors. About me specifically? About Carrick Valley. About why the record was altered. A pause. He's claiming the alteration was directed by someone above his level. He's naming a superior officer as the primary architect of the falsification. Who? Sloane asked. Yi said a name. The elevator reached the ground floor and the doors opened, and the sounds of the hospital lobby came in. The PA system, the desk phones, the particular low-level noise of a building full of people. And Sloane stood in the elevator without moving while the name settled into the framework of everything she knew and rearranged it in a way she had not anticipated. The name Yi had just said was someone Sloane had spoken to twice during her discharge process. Someone she'd considered, in her limited experience of the process, to be operating correctly. Someone whose signature appeared not on the falsified after-action report, but on her own DD-214, her honorable discharge. Are you saying, Sloane said very carefully, that my discharge was part of this? We're saying, Yi said, that the timing of your discharge and certain details of how it was processed are now part of what we're looking at. The elevator doors tried to close. Sloane put her hand out and stopped them. What does that mean for me? She asked. I don't know yet, Yi said, but I need you in this conference room at 8 tomorrow morning with everything you remember about your discharge process. Because if Druce is telling the truth about who directed him, and if that person's involvement extended to your separation from the service, then what happened to you wasn't just about Carrick Valley. Sloane lowered her hand. The elevator doors closed behind her. She stood in the lobby of Hargrove Regional Medical Center, while the ordinary machinery of the hospital moved around her, and she understood, with the particular clarity of a moment when multiple lines of information converge into a single point, that the thing she'd driven to Millhaven to escape had not been following her. It had been waiting here, and it was considerably larger than she had known. She didn't move for a full 30 seconds. The lobby sounds continued around her, a child crying somewhere near the vending machines, a PA announcement about a vehicle with its lights on in the south lot, the automatic doors opening and closing for people who had somewhere to go. The ordinary indifference of a building that didn't stop for anything, including the particular kind of revelation that rearranges a person's understanding of their own history. Her discharge had been processed. Her DD-214 had been signed. She had been given an honorable separation and sent into civilian life with the standard documentation and a handshake from a colonel she had met twice, and she had accepted all of it because she'd been 24 and depleted, and the only thing she'd known clearly was that she needed to leave. She had assumed, because it was the simpler assumption, that leaving had been her own decision. She pressed the elevator button again and went back up to the third floor. Briggs was in the hallway outside room 308, standing in the particular way he stood when he was processing something rather than waiting for something. Yi called you, he said when he saw her face. How long have you known about the discharge connection? She asked. Suspected, he said. 3 weeks. Known 2 days. He said it directly, which she appreciated even though it landed with weight. I didn't want to tell you before there was something concrete to tell. I didn't want to hand you a theory. Who signed my DD-214? Brigadier General Marcus Alt, Briggs said, currently under federal investigation for his role in the broader Carrack Valley falsification scheme. Druce reported to him. The equipment contracting decision that left your unit without adequate supplies was traced back to a procurement authorization that Alt signed off on 8 months before the mission. She absorbed this. He signed my discharge, she said. So I would leave. So you would leave without asking questions, Briggs said. You were the primary field witness to the equipment failure. Getting you out of the service quietly, with an honorable discharge so you'd have no grievance to file, no formal platform to speak from. That was neater than the alternative. Which was? Letting you stay in long enough to talk to the right people. She looked at the wall across from her for a moment. Not at anything on it, just using the direction to hold herself while the new shape of the thing settled. So they discharged me to silence me, she said, and I went and became a nurse, and I wrote it all down, and I put it in a box. Yes, Briggs said. And now Alt is using Druce's cooperation statement to try to reduce his own exposure, she said, by claiming Druce operated independently. That's the current posture, Briggs said. Yi's team is working through it. The problem for Alt is that the procurement authorization has his signature. Druce's testimony establishes the intent. And your notebook establishes the field reality that contradicted what both of them signed their names to. She was quiet for a moment. He's going to say Druce is lying, she said. He's already saying it, Briggs confirmed. His attorney made a statement to that effect at 4:30 this afternoon. And the notebook? The notebook is physical evidence with a chain of custody that starts with you and ends with a federal evidence locker, Briggs said. His attorney is going to challenge it. They'll argue it's self-serving, that it was written after the fact and backdated, that there are avenues. He paused. None of them are strong avenues because the clinical detail in what you wrote is the kind of detail that doesn't come from retrospective invention. Anyone who understands field medicine is going to read that notebook and know it was written by someone who was there. She thought about the motel room again, the heater clicking, the field notebook, the way her hands had moved across the paper because she'd needed the movement as much as the record. What do I need to do tomorrow? She asked. Walk Yi through the discharge process in the same detail you walked her through Carrack Valley, Briggs said. Every meeting, every document, every conversation. She needs to establish the timeline between what happened in the valley and when the separation was initiated. Okay, she said. Briggs looked at her with the same reading expression he'd used the night before. I'm fine, she said, before he could ask. I know, he said, differently than before. She went home. She didn't sleep much, but she slept enough, and she was at the hospital conference room at 7:58 with coffee she'd made at the apartment and the same focused quality she brought to every shift, the decision to be present for the thing in front of her, whatever the thing was. Yi was already there, with a second attorney Sloane hadn't met, a woman named Kessler who specialized in military law and had the specific quality of someone who had spent years in a field that required both precision and the willingness to be aggressive with precision. The session lasted 3 hours and 40 minutes. Sloane talked. Yi and Kessler asked questions. The technician recorded. Outside the windows, Millhaven's North Ridge went from gray-green morning to the sharper, cleaner light of mid-morning, and the hospital below the conference room ran its ordinary operations, and Sloane described every document and every conversation and every date she could remember from her discharge process with the same clinical specificity she'd used for Carrack Valley, because the clinical specificity was not a performance. It was simply how she'd been trained to observe and record, and that training had outlasted the context that produced it and turned out to be useful in ways she couldn't have anticipated from inside a valley in the worst 4 hours of her life. At 11:20, Kessler set down her pen. The gap between the mission date and the discharge initiation is 9 days, Kessler said. That's the fastest separation processing we've seen in any case in this investigation. Standard processing is 60 to 90 days minimum. I was told it was expedited because of my injury status, Sloane said. Your injury status would normally have extended the process, Kessler said, not compressed it. She looked at Yi. 9 days puts the initiation in the window before the after-action report was finalized, which means the separation was started before the official record was complete, Yi said. Which means whoever initiated it wasn't responding to the record. They were preempting it. The room was quiet. Sloane had known intellectually from the moment Yi had called last night where this logic led. But there was a difference between knowing a thing intellectually and sitting in a room while two attorneys traced the shape of it out loud. And the difference was the particular feeling of something that had been blurry for 3 years coming into focus with a resolution that was both clarifying and, in its way, a form of loss. Because the blurry version had at least been ambiguous, and ambiguity left room for the possibility that the exit had been her own. My discharge, she said carefully, was initiated 9 days after the mission, before the report was written, by someone who needed me gone before I could contradict a record that didn't exist yet. That is what the evidence currently supports, Yi said. They didn't just change the record, Sloane said. They removed the witness first. Yes, Yi said. She sat with that for a moment. Then she said, "What do you need from me for the formal proceeding?" Kessler looked at her. "You're willing to testify?" "I've been testifying for 2 days," Sloane said. "I can do it on the record." The formal proceedings were not a single moment, but a sequence of them, and they did not resolve in the clean way of things in films, but in the grinding, procedural way of things in law. Documents filed, hearings scheduled, evidence reviewed, motions made and countered, the whole apparatus of institutional accountability, moving at a pace that was simultaneously too slow for the people inside it. And, Sloane was told by Kessler, remarkably fast by the standards of federal military investigations. She worked her shifts at Hargrove Regional through all of it. This was, she decided, the correct approach. Not because she was performing normalcy, but because her patients needed the same things they had always needed, regardless of what was happening in conference rooms in Denver. And the act of providing those things was not separate from who she was. It was the other half of who she was. The part that hadn't come from the valley, but had been shaped by it, refined by it, sent in a specific direction by the experience of knowing what it meant for the right person to be there with the right knowledge at the right moment. She kept caring for people. Alt's attorney filed 3 motions in the first 2 weeks. All 3 were denied. The procurement authorization with his signature was entered into evidence. Drews, whose cooperation agreement had been formalized, testified to the chain of instruction that had originated in Alt's office. 3 other soldiers from Carrick Valley, who had been contacted by Yi's team and who had their own quiet records of what the mission had actually looked like, provided supporting statements. The composite picture that emerged was not complicated. It was simply the truth, which had always been there, documented and remembered and waiting in a motel notebook and in the bodies of the people who'd survived. Alt was indicted on 6 counts, including falsification of military records and procurement fraud, on a Thursday morning in October, 43 days after Gerald Farr had walked into Hargrove Regional's lobby with an injunction application that arrived too late. Sloane found out through Briggs, who sent a text that said only, "It's done. Alt indicted. All 6 counts." She was between patients when she read it, standing in the corridor outside Bay 4. She read it twice. Then she put her phone in her pocket and went in to check on her patient. Farr had cooperated fully and received a reduced agreement, which meant he would face consequences but not the full weight of what full accountability would have required. Sloane had complicated feelings about this, which she didn't express to anyone in particular because expressing them wouldn't change the outcome. And she had learned, over time, the specific discipline of distinguishing between grievances she could act on and ones she had to simply carry until they became lighter. Drews lost his position and his pension and faced federal charges that Kessler estimated would result in significant prison time. The contracting company whose equipment had failed in the field, whose relationship with Alt and Drews had been the financial engine behind the entire falsification, was referred to a separate federal investigation involving procurement fraud. The program itself, the readiness protocol that Carrick Valley was supposed to have validated, was suspended pending review. The suspension was the thing that mattered most, in the way Sloane thought about it. Not the charges against the individuals, which were satisfying in the limited sense of accountability taking a recognizable shape, but the suspension of the program that meant no one else would be sent into a field situation with equipment that had been certified by men who'd falsified the evidence of its failure. That was the practical thing. The thing that changed the outcome for people who didn't yet know their outcomes needed changing. Colonel Shea called her at the end of October. "There's going to be a formal recognition," he said, "military commendation for your service. Not just Carrick Valley, the full service record, including the role you played in the investigation. We'd like to do it at Hargrove Regional if you're agreeable. It seemed appropriate. She thought about it. Yes, she said. That's appropriate. There will be some coverage, he said. Not a press event, but it'll be on record, and some people will report it. Okay, she said. You're sure? Colonel, she said, I spent 3 years being invisible. I think I can handle being visible. He made the sound of someone who didn't quite laugh, but registered the point. The date was set for the second Friday in November. Caldwell came back. He was cleared for travel 2 days after the repositioning incident and transferred to a military medical facility, and Sloane had thought that would be the shape of the ending. A brief passage through her life, significant and then gone, the way some things were significant and then gone. But he came back in late October, driving his own truck this time, walking under his own power with a careful quality that told her the left side was still working through something, but was working. He found her during a shift, which she'd expected. You didn't have to come back, she said. I was in the area, he said. She looked at him. I was in Denver for the deposition, he said. Millhaven is on the way back. Millhaven is not on the way back from Denver to anywhere. It is if you define the route generously, he said. She almost smiled. She recognized it as an almost, which was more than she'd managed with most things in the last month. How's the side? She asked. Annoying, he said. Functional. PT? 3 times a week. The therapist tells me I have poor range of motion in the left shoulder and an attitude problem. She's probably right about both, Sloane said. He looked at her with the kind of look that had layers in it. Not all of them she could read, and she didn't try to read the ones that weren't offered. The indictment, he said. I heard. 6 counts? He said. Kessler said the sentencing guidelines put him at, but I know the guidelines, she said. Kessler keeps me informed. He nodded. You okay? He asked. I'm working on it, she said. It was the most honest answer she'd given anyone who'd asked that question in the last 43 days, and she gave it to him because he was someone who would receive honesty without requiring her to then manage his response to it. That's the right answer, he said. I know, she said. It took me a while to find it. He left after 40 minutes, with the number she gave him without him asking for it, and she went back to her patients and didn't think too much about what any of it meant because some things needed time to be understood, and time was one of the few resources she trusted. The day of the commendation was cold and clear, which was the specific weather Millhaven produced in November when it was deciding to be cooperative. Sky so blue it looked manufactured, air that was sharp enough to be uncomfortable but honest about it. The ceremony was in the main lobby of Hargrove Regional, which had been rearranged slightly for the occasion. Chairs set out, a small podium, the assembled presence of Colonel Shea and 2 other officers, and Kessler and Yee, and most of the day shift staff that could be spared from the floor, and several people Sloane recognized from Caldwell's team, including Briggs, who was standing with his arms crossed, and the specific expression of someone who was pleased but would not be performing it. Janet Holt was there. Dr. Sandoval was there, and Dr. Ewan, and Pete Navarro standing slightly to one side with the expression of someone who was genuinely glad about what was happening and not complicated about it, which Sloane found she was more grateful for than she'd have predicted. Tiff was there, in the back, looking like she was holding herself together by something thin. Rachel Voss was not there, which was the right call. Rachel had made her accounting with herself, and Sloane had made her peace with the accounting, and the space between them was not hostility. It was just the appropriate distance of 2 people who had been in something together that neither of them would describe as good, and who had both come out on the other side of it changed in ways that didn't require continued proximity to consolidate. Caldwell was there. I was in the second row, sitting because the standing was still more effort than it looked, and when she came through the door and their eyes met briefly, he gave her the smallest nod, the kind that said, I see you without requiring anything additional, and she received it without deflection. Shea spoke first. He was brief in the way of people who respected their audience enough not to perform at them, and the things he said about Carrick Valley and about the investigation were accurate and measured and carried the weight of things said publicly on record by someone who understood what public record meant. Then he spoke about Sloane specifically. He said she had served with distinction in conditions where distinction was measured not by the absence of difficulty, but by what was done inside it. He said the record she had maintained, the notebook, the dates, the clinical specificity, was the kind of professional and personal integrity that institutional systems depended on even when they didn't know it. He said that the people who had tried to silence her had misjudged, in the fundamental way that people who underestimate others always misjudged, what silence actually meant. They had assumed it meant absence. It had meant, instead, that everything she knew had been put somewhere safe until the moment it was needed. He said her name and presented the commendation, a formal military document with the specific language of official recognition that she had not expected to feel anything about and felt something about anyway, in the way that being told the truth of a thing out loud differed from knowing the truth privately. She received it without looking at what it said, because reading it later was a different act than receiving it publicly, and she wanted to keep both acts separate and whole. Then Shay did something she hadn't expected. He stepped back from the podium and looked at the assembled staff of Hargrove Regional Medical Center and said simply, "This woman came to work in your department with no announcement, no explanation, and no visible evidence of what she'd been through and what she was capable of. She asked only to do her job. What she was given instead was suspicion and obstacle." He paused. "What she did with that is what we're here to acknowledge. But I want to say something to this room that isn't about commendation. It's about the fact that it should never have taken a federal investigation and a wounded soldier to establish her value here. Her work established that. On the first day, the rest of us just weren't paying the right kind of attention." The room was quiet. Pete Navarro was looking at the floor. Janet Holt was looking at Sloane with an expression that held the complicated weight of someone who understood that being included in the rest of us was both accurate and uncomfortable. Dr. Sandoval, who was not given to visible emotion, had her arms crossed in a way that suggested she was using the posture structurally. Sloane stood at the podium and looked at the commendation in her hands and then at the room. She hadn't prepared remarks, because she didn't know what she was going to say until she was standing there and the room was looking at her, and it became clear what was true. "I came to Millhaven because it was quiet," she said. "That wasn't what I got. What I got was harder and more complicated and—" She paused. "Worth it, in a way that quiet wouldn't have been." She looked at the document. "I spent 3 years with the record of what happened in a valley locked in a box. Not because I was hiding it, because I didn't know who needed it yet. It turned out the right people needed it at the right moment, and the moment arrived because I was standing in the right place when a man came through those doors bleeding." She looked up. "I'm a nurse," she said. "That's what I am now. That's what I chose. And I chose it because the thing I learned, in the valley, in the years after, in 11 days of being told I didn't belong in this building, is that the most important thing a person can do is stay." She stopped. Chose the next word carefully. "Stay for the patient who needs you. Stay in the work that costs you something. Stay visible when it would be easier not to be. The scars on my arms are from staying. I used to cover them. I don't anymore. Not because they're decorative, because they're accurate. They're the record of what it actually looked like when I didn't leave." The room was still. Then Pete Navarro started clapping, which was surprising because Pete was the last person anyone would have predicted to initiate applause. And then Sandoval, and then the sound built in the lobby of Hargrove Regional Medical Center, until it was the full, slightly ragged sound of people who were feeling something they hadn't been certain they were allowed to feel. Briggs was standing in the back with his arms still crossed, but his hands were moving. Afterward, in the gradual dissolution of the gathering, people finding their way back to their posts, the chairs being moved, the lobby returning to itself, Sloane stood near the front window with the commendation document and Shay approached her. "There's something else," he said. She looked at him. "The investigation's findings, particularly the procurement aspect and the equipment protocol failures, are being compiled into a report for the Oversight Committee. The committee wants expert input on revised field medical standards." He paused. "Your name was submitted as a clinical consultant, former combat medic, current trauma nurse, direct field experience with the specific equipment failures under review." Another pause. "It's not a military appointment. It's a civilian consulting role. You'd keep your position here. It would be occasional, not ongoing." She looked at him. "They want my opinion on field medical standards," she said. "They want the opinion of someone who improvised solutions to equipment failures under fire," he said, "and then spent 3 years working civilian trauma. That specific combination of experience is not common. She thought about Mr. Delgado, who had told her it was okay to be somewhere else for a minute. She thought about the panic attack patient and the applesauce and the referral to outpatient psychiatry. She thought about the chest tube in a storm and the field notebook in a motel and the 4 hours in a valley that had shaped every decision she'd made afterward without her fully understanding the shape. She thought about what it meant to have information that could prevent the next Carrick Valley, not by testifying about the last one, but by putting the knowledge of what had failed into the hands of people who decided what was available to the next medic in the next valley. "Yes," she said. Shea nodded, the brief nod of someone whose expectation has been confirmed rather than surprised. He left. She stood at the window. Outside, Millhaven was doing what it did in November. The light going early, the ridge lines going dark, top to bottom, the town in the valley holding on to the last of the afternoon. The way places did when they'd learned that winter was coming and there was no point arguing about it. She'd driven into this valley wanting quiet and gotten something harder and more complicated, and she'd said it out loud in front of a room full of people, so she had to mean it, worth it. She still didn't know if she'd stay. She'd lived out of boxes for 3 years and the boxes in her apartment were still mostly unpacked. Some people lived in transit as a permanent condition, and there was a version of her life where that was what she did. Consulting, moving, applying the particular compound experience of someone who had been through significant things and learned from them and carried the learning into the next context. But she was also, she acknowledged, standing in a building where people knew her name, where Pete Navarro would tell anyone who asked that she was the nurse who caught the medication error and the hemothorax and the manipulated chest tube, not necessarily in that order of importance. Where the young nurses who'd been watching the last 6 weeks would remember that the woman with the scars on her arms had done her job correctly every single day, regardless of what was happening around her. That was something. That was a thing that didn't exist everywhere. Caldwell appeared beside her, which she'd heard coming because she heard most things. "You're deciding something," he said. "I'm always deciding something," she said. "About staying." She looked at the window, at the ridge going dark. "I don't know yet," she said. "Fair enough," he said. They stood at the window for a moment in the comfortable quiet of people who had been through enough together that silence didn't require management. "The thing you said up there," he said, "about staying, the scars being the record of not leaving." "Hartfield," he said. "He's got scars too. Different places. He's got a landscaping business and 2 kids, and he's okay." A pause. "He called me last week after the indictment, first time in 2 years. He said he'd been carrying the weight of Carrick Valley and not having a name for why it went wrong. And now there was a name for it." Another pause. He said it helped, having a name for it. She thought about that. "Accountability isn't the same as healing," she said. "No," he said, "but it's a precondition for some people." She thought about the 6 men and the valley and the notebook and the box and the 3 years and the drive to Millhaven and the particular morning she'd walked into Hargrove Regional with her sleeves pulled down, and within 30 seconds the whispering had started. They had looked at her scars and seen damage. They had been looking at the wrong record. The scars were not the record of what had been done to her. They were the record of what she had done. The 4 hours, the improvised solutions, the staying when leaving would have been the easier geometry. They were evidence not of breaking, but of the particular kind of persistence that doesn't announce itself, that keeps its documentation in a motel notebook in a safe deposit box, that shows up for the next shift and the next patient and the next moment that requires someone to know what to do and do it. She had been underestimated, and she had been managed, and she had been nearly removed, and she had watched the people who did all of that face the weight of having done it. That was not a clean ending. It was a true one. The difference between those 2 things had taken her most of her adult life to understand, and she understood it now, not as a comfort, but as a fact, and facts were what she had always worked with. "I should go check on a patient," she said. "You're off shift," Caldwell said. "I know," she said. "Mr. Delgado. He's on day 5 of antibiotics, and his wife is driving up from Pueblo this afternoon, and I said I'd check in." Caldwell looked at her. "That's just who you are," he said. Not a question. "That's just who I am," she said. She tucked the commendation under her arm and walked back into the hospital, through the lobby, where 30 minutes ago a room full of people had finally looked at her correctly, down the corridor toward the elevator, past the nursing station where Pete gave her a nod of the specific variety that in Pete's emotional register was approximately equivalent to a lengthy speech about respect and reliability. She took the elevator to the second floor. She walked to room 214 and knocked on the open door and found Mr. Delgado sitting up in bed with his wife beside him. A small woman with gray-streaked hair who looked at Sloane with the particular expression of a person who had been told things about someone and was now assessing the original. And Mr. Delgado's face did the thing it did when she came in, the thing that was partly relief and partly the comfort of a known quantity. And he said, "There she is." "Here I am," she said. She checked his chart. His infection markers were down. His temperature was normal for the second day running. He was going home tomorrow. "You look different," he said. "I had a thing," she said. "A good thing or a hard thing?" She thought about it. "Both," she said. "In the same package." He nodded, in the way of someone who had been alive long enough to recognize that description as the most accurate version of most significant experiences. His wife was looking at Sloane's arms, not with the assessing judgment of someone deciding what the scars meant, but with the open curiosity of someone who simply noticed and was not afraid to have noticed. "My husband says you're the best nurse he's had," she said. "Your husband is generous," Sloane said. "My husband," she said, "is accurate." Sloane looked at Mr. Delgado, who had the expression of someone who was going home tomorrow and knew it and was glad. She looked at her own arms, briefly, the way she sometimes did now, not checking that the sleeves were covering anything, just looking. The scars in their particular topography, the lines that ran from wrist to below elbow on both sides, permanent and specific in hers. She had stopped covering them, not because anyone had asked her to stop, or because the ceremony this afternoon had made them suddenly acceptable, or because the commendation document under her arm had validated them into something they hadn't already been. She'd stopped because she'd finally understood what they were. Not the evidence of a wound, but the record of a decision. The decision to stay in a valley when the valley was the worst possible place to be. The decision to write it down when writing it down seemed like a thing for her alone. The decision to drive it to Denver in the middle of the night and hand it to a prosecutor in a conference room when handing it over meant becoming visible in a way she had been avoiding for 3 years. All of those decisions had looked, from the outside, like the decisions of a quiet person, a background person, the kind of person who kept their sleeves down and their past private and didn't cause trouble. They had been the decisions of someone who knew exactly what she carried and had been waiting for the moment when carrying it alone was no longer the right choice. She checked Mr. Delgado's vitals one more time, updated his chart, told him she'd see him in the morning before his discharge, and said goodbye to his wife, who shook her hand with both of hers in the way of someone who meant the gesture. She went back out into the corridor. The hospital ran around her in its relentless way. Nurses at the station, monitors doing their monitoring, a cart of medication being wheeled somewhere with the specific efficiency of a place that had no use for pause. She stood in it for a moment, not hiding, not performing, not managing the distance between herself and the space. Just standing in a building where people knew her name and knew what she was capable of and had been told, on the record, what the scars on her arms actually meant. It wasn't quiet. It was better than quiet. It was the sound of work that mattered, and she was the person doing it, and no one in this hallway or any other hallway in this building had any remaining uncertainty about that. She straightened, tucked the commendation more securely under her arm, and went to see who needed her next.